Good morning, everyone. My name is Anthony Smith, and I serve as the Public Information Coordinator for Juvenile Court. On behalf of Judge Sheila Calloway and the entire Juvenile Court staff, I want to extend a warm welcome and sincere thanks to each of you for being here today. We want to give a special thanks to the court's grant team made up of Ms. Shelley Hudson and Ms. Nicole Whitlock. Their hard work has made today's event possible. Before we begin, a few housekeeping rules. We ask that all presenters, panelists, and guests please silence or mute your cell phones as today's session is being recorded. In the mayor's proposed budget, $200,000 was allocated to support nonprofit organizations doing meaningful work in our community. And we're excited to hear directly from this year's applicants. Each presenting organization will have 15 minutes to share their proposal, followed by a 5-minute Q&A question and answer session with the panel. Please be sure to introduce your organization and your team to the panel before starting your presentation. If we stay on track, we're going to take a short break, probably around 10:30. So before we begin, I'd like to briefly share the order of today's presentations. Each organization will present in this order. Again, each group will have 15 minutes for your presentation, followed by 5 minutes of Q&A. The presenters are Black Lemonade, Valor Collegiate Academies, Tennessee Voices, Raphi Institute, Rock Life Youth, Epic Girl, Stars, Oasis, and then Pathways Kitchen. They will come in that order. Again, we appreciate each organization's preparation and participation, and we're excited to hear more about the important work that you're doing in the community. Again, thank you for your time, your energy, and commitment to serving Nashville's youth and their families. Thank you.
Good morning, you all. I am Adrian Washington. I'm going into my 10th grade year of high school. I attend Hillsborough High. I've been with the program Black Lemonade for about 2 weeks now, working an internship. And my why I chose Black Lemonade is because Black Lemonade helps to occupy my time and keep me from doing things that people my age would be doing, like partying, taking drugs, and things like that, and things of that nature.
Good morning. My name is Coticia Blue. I am an upcoming sophomore. I go to East High School. The reason why I play basketball is to move my mom out of Nashville, and I've been with Black Lemonade for 2 to 3 weeks now.
Good morning. My name is Tiara Flemings. I'm an upcoming sophomore. I go to Procon High School. I've been with Black Lemonade for about 3 years now. And my why in life is I like to bake because it helps me bring comfort, and it also helps me connect with my grandma.
Good morning. Good morning. My name is Kami. I am the founder and CEO of Black Lemonade. A little bit about Black Lemonade. I founded this organization at the height of indifference. Our world was at indifference. We're also experiencing COVID. So this is June of 2020. If you guys can mentally take yourself back to that time. Had a colleague that kind of was like, Kami, this is your area. What can we do to kind of better our situation, better our communities? And I say I was at the right place, right time, right conversation. I look to my left, I see a stand of lemon decor. The quote comes to mind, when life gives you lemons, make lemonade. And so that's what we set out to do for our minority and underserved communities. As you will see within this presentation, I believe that education is just as important as experience. So please bear with us with any nervousness that you guys might sense from our youth. They have been with this program in an internship capacity, and they've been doing amazing. So to be in front of you guys today is definitely an opportunity and an experience for them to see other things and other opportunities that are available to them outside of what they just mentioned, sitting at home or anything like that.
We would like to tell you a little bit more about the program Black Lemonade. Black Lemonade provides ongoing support to underserved youth and is focused or centered around the saying, when life gives you lemons, turn them to lemonade. Basically, what the program means by that is that even when you aren't in the best situation, try to make the best possible out of your situation.
More about turning lemons into lemonade. What we mean by turning lemons into lemonade is we helping the youth get ready for life and ready skills so they won't just be sitting at the house, so they can have something to do and to have a smile on their face.
Black Lemonade, it creates pathway for all youth to strive, and it also provides skill and practices for youth to take.
One thing I wanted to make sure that I did when I started an organization was first listen to our community. Of course, with the term Black Lemonade, I started with the community that I knew, which took time with first listening, seeing what the needs are, not just going in and acting and saying, this is what you need. So the first step that we do take is listen, making sure that we're hearing our youth, we're hearing our families, we're hearing the community. Where are we struggling at? Then we'll educate ourselves in that area if it's something that we are not used to providing solutions for. So we are very intentional in making sure that we listen, whether that's through surveys, community support groups. I'm really heavy on family engagement opportunities. Then we go into educating ourselves on that community, educating ourselves on the issue, and then we act. So we want to make sure that everything that we do is very intentional and not something that we are being forcing upon our community.
So on this slide, this is a list of our financial partners, and we also have over 40 enhancement partners who all help us get the things we need, like resources, or even just small things like partnering with us to help us take care of our youth.
And also where we're located, we are located in Indiana, Memphis, and Nashville. Funding needs. Funding will cover transportation, materials, support our ability to maintain. And what we mean by helping funding needs is where that we have transportation so we can help our youth go out to focus on more than their phones and to see more to our culture and to see more things that they know from the cellular device.
You want to say something?
Okay, so Black Lemonade uses funding for things such as transportation, classes like financial classes that can teach you about life, like financial classes, banking classes, or just classes about career readiness for whatever the youth who goes or attends the camp wants to do later on in life.
I anticipate this specific program in one of two ways. We can do a kind of a recidivism type of program, rehabilitation, to where youth, instead of going into juvenile, they can come to our program, whether that be a 6 to 9 month program. Once they are out of juvenile, they can attend the program for 6 to 9 months. And then we've also already done kind of a pilot program where we've actually gone into the juvenile and we've done these experiential learning with them. They have made lemonade with us, and being able to put the fruit and seeing that they're not drinking the seeds into the juicer and things of that nature. So we do foresee this being at the high end, about $3,750 per youth, with a goal of serving 40 youth within that 6 to 9 month time frame as well.
Our approach in Black Lemonade is grounded towards the positive youth development and restorative justice, and also trauma-enforced care. We try our best to incorporate only database supported by skill accusation.
So this slide really just goes back to what I mentioned about we listen, then we educate, and then we act. So not making sure that we're not reinventing the wheel, making sure that we are using practices that have already been proven to be successful, whether that's something that we've done based off of trial and error, or something to where it was an education moment for us to go and educate ourselves in that area, whether that's professional development, community resources, data that has been made public to the community as well. So making sure that we're just not, again, acting without first listening and educating ourselves.
The funding we get, like the community funds from NASA, are tracked and reported only are reported through fully so that we meet all funding requirements for the youth.
Black Lemonade holds our relationships with funders and stakeholders very seriously, making sure to update funders and stakeholders on how their money is used to provide for the camp and what we do with their money to make sure that the children have a great time at the camp.
Some of our key staff in dealing with fiscal management, obviously myself, the founder and CEO, just making sure that funding is being spent appropriately. We do have a bookkeeper who makes sure that everything is reconciled on a monthly basis. An accountant who will oversee yearly things such as your taxes and making sure that the reconciliation is being done properly. We also have an internal and external auditor who will also make sure that annually we're making sure that those reports are given. I myself usually deliver all of the monthly reports, and our board is very active in this area as well, making sure that everything gets approved before spending, that it's clear, concise, and that it makes sense. And then we have a treasurer as well who communicates those financial statements to our board. So our staff are very well-versed on, making sure that receipts are submitted, making sure that we're spending within the allocated budget and things of that nature.
We have very many different types of monitoring that we use around the camp for the youth, such as daily check-ins. Daily check-ins is basically where we are checking in with the youth from the time that they come through our doors throughout the day and the time that they leave, making sure that everything goes well around the camp, making sure their mental state is okay and straight, and making sure that everything is just well and is going great.
The youth do surveys and get feedback about how they are feeling about the program. If they are improving, needing, there is space for them to state their needs. Is what we mean by state their needs is to, let's say a camper need water. One of our campers is going to go around, go inside the lunchroom and grab water so the student could be hydrated.
Each session here at Black Lemonade is logged and tracked, so we know who came to the camp on this certain day, who didn't, and who participated, who didn't. So we log everything at Black Lemonade.
With that being said, we do have a intended student-to-staff ratio. We tend to try to keep a 1-to-15 staff ratio. For things such as field trips, enhancement partners coming in, we do want to do a 1-to-10 to ensure the behavior management is upkept. Partnerships, experiential learning, things of that nature. We also use a data system. It's called ProCare that actually tracks everything that we need to know about our youth on site. This is something that we're able to print out, something that we're able to have on our phones if we need to reference it. This includes information provided to us by parents, whether that's an IEP, tracking data, attendance. We're able to do behavior reports, incident reports, mood reports. We do believe that incident reports are just as important as praise reports. So being able to submit that information to the parents and saying, hey, if your student was nervous day 1 and day 2, but day 3, their personality came out, we want to submit that type of data to anyone who's able to use that. The way that we collect data is a multifaceted data strategy. We are very familiar with doing data sharing agreements. We do have one with MNPS right now. We have one with the families that we serve, and we are very, very heavy on building rapport with our families and students. I myself have done the home visits to where I'm actually in the house asking, what is the need? I'm looking around. I'm not judging, but I'm providing that solution. If I see that there, isn't water in the refrigerator, the next day you're going to have that water in that refrigerator. So we're very intentional on literally turning lemons into lemonade. We do interviews with parents and guardians, making sure that we're doing our surveys, staff reflections, journaling, any way that they can self-express themselves so that we can continue to build that rapport, listen to them, and then act on what is actually needed. But Black Lemonade evaluations, to clearly define our output measures, we will number the count the number of workshops held successfully, field trips conducted, the trade sessions that we complete, the mentor meetings logged, youth, family, staff, partner surveys will be conducted as well. We anticipate our youth doing workshops that are home life skills, things like unclogging a toilet, things like knowing how to do your laundry, how to properly vacuum, and then trade skills as well to make sure that youth go away from our program with at least one trade skill before they leave with us. On top of that, we do believe, again, that education is just as important as experience. If you guys go into our YouTube channel, you guys will see that we've taken our youth to Atlanta and Memphis so far. But being able just to go outside of the community that raised them, being able to see other things that they wouldn't have gotten to see had they not been with Black Lemonade. And again, if this is a program, two ways that we could do this, either as a rehabilitation, as something that is alternative to going into juvenile, or even bringing that experience into the juvenile facility as well. I mentioned how we brought in making lemonade with the youth and being able to do little things that they haven't done before so that they can gain that experience. In order to sustain this, we did show a list of our funding partners that we currently have, ongoing funding partners, as well as our over 40-plus partners, enhancement partners that can kind of come in. We do have a diversified grant portfolio, earned revenue income streams, so we do offer services and products as well to sustain funding. Making sure that we're continuing our corporate and community partnerships, collaborate with partners in the community. We don't believe in reinventing the wheel, but also just, again, expanding the horizon and allowing our youth to experience other things. Individual donor campaigns, and then we're really heavy on retention. If the youth are there, we're able to kind of prove that not only are they enjoying this, but that it is productive and proactive to bettering their life. So thank you guys so much for this time. And I guess this is the part where we go into questions. Oh, thank you.
Good morning.
Good morning.
First, I want to extend my admiration for you young people getting up in front of adults and occupying such an important role. I think you all are beautiful, and thank you for being here. I do have just one question I wanted to ask. There's two questions. Your training module, are you using evidence-based trainings, or are you creating your own? Secondly, with your data evaluation that you're collecting, is that from a evidence-based model or strategy, or did you all create your own?
Yes, so on your first question, that was pertaining to staff training. Yes, so we do use evidence-based training. My staff took a 3-day training just for our summer camp. This includes doing the Enneagram testing to make sure that we're identifying their leadership styles and how they best mesh with the Black Lemonade mission and vision. We brought in consultants who helped us with elevator pitches to actually help them see their why so that they can then incorporate other people's whys, because you kind of heard our youth's whys today on why they do the things that they do. So we make sure that our staff kind of go through the same things that we want our youth to go through. We also focus really heavy on engagement. So we brought in another consultant who provided us resources and books and things of that nature on making sure that engagement is high, making sure that our students are on board. We are, outside of this program, we are an electronic-free organization, so our kids cannot be on phones, tablets, TikTok, all that kind of stuff. We are the live TikTok. So when they are with us, they are not bored, and we do use evidence-based practices for that. For your second question, remind me.
What data collection and analysis model are you using with the information that you are gathering?
Absolutely. So we use the data sharing agreements, of course. We use our registration forms, and we use surveys, both internal and external. We bring all that data together, and our board actually reviews that on a quarterly basis, and we have a very long board meeting at the beginning of the year to kind of evaluate that data on a year-to-year basis, on a quarterly basis, to then go back and say, okay, this is what we need to change. Our staff actually have weekly meetings as well based off of said data that we might collect within a monthly basis or a weekly basis so that we can reevaluate everything that we've done.
Thank you.
Absolutely.
What's the most impactful thing about the camp?
About our summer day camp, the most impactful thing, I'm gonna say experience. We don't do the sitting behind the desk, pencil and paper every single day. The program that they're in right now, they are actually creating community service projects from start to finish that they will lead for our younger youth to actually do. But I think that having them up, having them active, having them immersed in their community is something that, to me, is the most impactful. The story that I always love to share is we have an after-school program as well. I had a youth who again, going back to building that rapport with our youth, I had a coordinator who kept seeing that a student was not eating. Every time we had a opportunity where a chef might come in and cook with them, or they had a culinary activity, that person would ask to be excused from that time. So my staff member let me know about that. We continued to monitor it. During our Thanksgiving time, we had a feast. He did not eat, so we talked to mom. Mom says, yeah, we had a unfortunate event and he has not eaten solid food since he was 2. So that immediately put me into solution mode. I hear what you're saying, how can I help? So this student was already exhibiting leadership qualities, leadership skills. I know we all say, you know, my kid's gonna be the next president. This kid could literally be the next president. We took that trauma and we turned it into literally lemons into lemonade, to where we allowed him to share his favorite fruits and vegetables, brought in a juicer. He juiced for the entire class. And then that was in November. By the time in December, mom reached out to us and said, thank you so much. We're out buying a juicer right now because we never even thought to do this. So experience, doing things that they've literally never done before, creating solutions that they've never seen before so that they can be productive, or so that they can provide their own solutions for their own life.
You mentioned the summer camps. What do you do during the school year?
Yes, so we have after-school programs. We're partnered with NASA in that capacity. We also have volunteer, we're in the high schools as well. We're in 2 high schools as well. Our after-school program is really focused on leadership again. They do community service projects at least once every semester. We've partnered with YSA, we've partnered with Youth as Solutions to make sure that they are understanding how to build a service project from start to finish. And then our summer camp is focused on superheroes. So they learn about different superheroes and then they act as superheroes as well.
All right, thank you. I think we have a time frame that we're supposed to be staying on, right? So I think we're a little bit over.
Okay.
Caticio Blue Jr.,
Yes, sir.
what's your mama name?
My mama named Mara Mitchell.
Mara Mitchell.
Elizabeth Mitchell.
Caticio Blue Jr. Did your daddy play football for White Creek?
Yeah. And he
Okay.
played baseball for Ice Creek.
Okay. Me and your daddy went to school together. Yeah.
Great job.
Thank you, guys.
Hello, good morning. I'm Stacia Freeman, the CEO and founder of Epic Girl, and I'm happy to be here with you all this morning. So I'm going to talk to you about our proposal for the psychoeducational empowerment programming that we offer in Bass and Johnson Alternative Schools. In the alternative schools, we serve girls ages 14 to 18, so girls in the high school program. This funding would be asking for a case manager that would be present 2 days a week per school. and psychoeducational empowerment, and to offer that educational curriculum and then the needed support. Epic Girl staff are trained in models using positive youth development, which builds resiliency and incorporates healthy adult supports to help young people recognize their potential by focusing on their positive qualities instead of their challenges or detriments, and encouraging them to live from that strength-based perspective. I think it's always important to tell a story about how we ended up in the alternative school. And Epic Girl has worked with girls in Davidson County that have had the most serious charges over the past 9 years. And one of the girls who had a significant charge, who was bound over into the adult system, said to me one day when I was meeting with her in the detention center was, "Are you in the alternative schools?" And I was like, "No." I don't know why I thought it was fine to be in the detention center, but I didn't want to go to the alternative schools. And she said, "Well, you need to be, because it is where a lot of us start out before we end up here." And I felt very challenged by that. And so I went over and met with Myron Franklin, who's the principal at Johnson Alternative, who's an amazing human being. And then he introduced me to Dr. Johnson at Bass Alternative, and thus, we started from there. So partnership-wise, our program partners are obviously Juvenile Court. We've partnered with Metro Government before and the Youth Violence Initiative. We partner with the Department of Children's Services to serve youth that are either dependent neglect or in juvenile justice. We have a private partnership with, the private organization Youth Opportunity Investments, who houses a lot of our hard-to-serve youth. We do have a partnership with Metro Nashville Public Schools, including the alternative education centers. The interesting thing is girls programming is funded through Metro with the regular school systems, but doesn't include the alternative learning programs. We also have partnered with Vanderbilt, Agape, Rafa, STARS, the Oasis Center, and Family and Children's Services, to name a few. Our program funding needs are that currently we receive limited funding to provide education and support in the alternative schools. And for this grant specifically, we're asking for $29,717 to $33,410.22 to fund a case manager to work 2 days per week in the alternative schools to specifically support the female students that we see there. The range would depend on how much we could do there, including like if our grant overseer could be funded as part of this project, and also if our operations person could be funded as well in a portion to help with the invoicing and the managing the paperwork. So our program is used as evidence-based practices. Primarily, I mentioned already, positive youth development, which is a view that really sees youth from that positive perspective versus the detriment or the challenges that they've been through. The other thing that positive youth development says is that kids really benefit from consistent, positive, healthy adults. And that's the challenge for a lot of nonprofits or agencies doing work with this population, is we do prescriptive methods of like, we're going to teach you all this stuff, but then there's no follow-up after that. And so my friend Andrea always says kids don't really care what you know until they know that you care. So Epic Girl really puts an emphasis on that. Additionally, my staff is trained in Real Essentials Youth Curriculum, which is a relationship-based educational curriculum that's designed to teach youth skills for combating challenges while promoting positive decision-making. All these lessons are inclusive, evidence-based, and medically accurate. Trauma-informed care services, which are built on evidence available and engage, empower, and collaborate with program participants. And strength-based case management. At one of the most extensively researched case management models, which utilizes traditional approaches but includes encouraging clients to identify their strengths, control, and be in control and a participant in their own care. Research shows that this model increases program retention. In terms of program fiscal management, we have an in-house accounting system. We utilize QuickBooks to do all of our reporting. We have had a decade of experience managing federal grant agents. The agencies pass through state agencies such as Tennessee Commission on Children and Youth, Department of Children's Services, and the Department of Human Services, as well as previous awards administered through juvenile court. Our in-house accounting specialist has over 20 years of nonprofit-specific experience related to reporting invoicing and managing funds. And we have a relationship with a certified public accountant who specializes in nonprofit audits and nonprofit reporting. Our program monitoring includes both qualitative and quantitative outputs. So it includes fidelity monitoring and timely reporting on performance measures. And our program director and our grant manager will oversee all evaluation activities, ensuring an average follow-up rate of up to 80%. The program data collection, we utilize a password-protected system, and it is web-based, HIPAA compliant to collect and store data, including all of our survey tools, our screening tool responses, our case management, participant tracking, and other relevant data. It also allows us to determine if we have done input from a youth that we've seen in the alternative school, but then they have a touch point with juvenile court, and then they have a touch point with DCS. It collaborates those records. So we're utilizing a new system this year that we're in process called Apricot through Bonterra that will allow us a little bit more, sophisticated way to keep up with data, because it can get really confusing when you have all these touch points. And a tool tracking informational gains will also be administered at 3-month intervals. So we'll use a baseline, then we do surveys to assess, does the young person, are they retaining the data? What have they learned? How are they applying that to their life? Do they feel more equipped to make better decisions? Are we seeing outputs in their behaviors? Are their risky behaviors reducing? And finally, are up to 67% of them staying in contact with their case manager? Our program evaluation, as I said, is qualitative and quantitative. Descriptions of the educational classes and case management services will be developed using screening tools, participant interview forms, program observation, and document review, like sign-in sheets and things like that. We also do a fair number of surveys where young people assess where they understand. Like a big one we see is trafficking. We assess girls based on what they understand about trafficking and what it is. And the number one word that they give us, we've collected over 1,400 surveys on this data, is kidnapping. And so it lets us know that we have a fair amount of educational opportunity to teach them about how social media can play into that. The outcome evaluation analysis involves preliminary analysis of the baseline data, which I mentioned, to examine their adverse behaviors and their current participation needs and what information they're gaining, which is what I said. Descriptive statistics of data to characterize the study population in terms of demographics, maladaptive behaviors, psychological functioning, stability and baseline knowledge, and analysis of changes from their baseline screening will be assessed using participant tracking and screening data over time. And I mentioned it's a 3-month interval. Our program sustainability, Epic Girls grown from a small startup in 2016. In fact, in 2015, we initiated a pilot project with Juvenile Court to implement girls programs, because at the time there were very few programs geared towards girls that had significant challenges. And now we serve over 500 girls a year. Our current budget is $600,000. We started at $31,000. As a founder, I just love to say that. We have a proven track record of sustainability. I will mention we survived COVID, which was touch and go there for a minute. Evident in the diversity of our funding streams and the grant awards received in our last 3 years of operation. We received grants from state and federal agencies, as well as local and national foundations. The program will be sustained through these entities, as well as individual and corporate donations, and also through events and fundraising campaigns. I know y'all are hungry, so I tried to finish early.
First of all, thank you for being here to tell us about what you do and what your program is about. Trauma training, who does that for you and your staff?
Well, we've done outside trauma training as well as I'm trained through the state's initiative on adverse childhood experiences
Okay.
and building strong brains. So that training is implemented through all of our mentor training because we also train about 70 to 100 mentors a year. And also our staff is all trained in that.
What is the name of the curriculum that you use?
So the Epic Girl curriculum is a curriculum that I wrote that is intertwined with the Real Essentials curriculum. So we use elements of both of those, which are both rooted in positive youth development, which is an evidence-based practice. I will also say I'm trauma certified through the National Institute of PESI. So, yeah.
And my last question is your outcome evaluation analysis. Which model are you all using to determine that?
How our outcome, well, we're using a statistical analysis that looks at pre and post-test screenings. So we're looking at baseline and then comparing the baseline incremental changes every 3 months. So we use a model that looks at prevention strategies. So prevention's divided into 3 categories: primary, secondary, and tertiary.
Right.
And we found that a lot of our kids fall between secondary and tertiary prevention strategies because a lot of them have significant ACEs by the time they see us. Which I will say we need more agencies that are working at the middle school level because I would love for them to work us out of a job. So a lot of times we're doing baseline, looking at the ACEs criteria and what kind of precursors they have to the behaviors, and then utilizing a behavior modification approach and measuring that based on 3-month intervals using pre and post surveys.
So with the pre and post surveys, correct me if I'm wrong, those are self-reporting, correct?
They are. We do a fair amount of program evaluation. So one thing I didn't say in the presentation is everything we do is in teams.
Okay.
So we have what we call a teacher and a watcher. And so a lot of times, like if we're teaching a curriculum, we can tell that a young person may be triggered from the curriculum, and we can make notes, and we also can allow for one-on-one time. But honestly, like a lot of our outputs are based on how connected that young person becomes, which is a hard thing to measure, but in reality, that's how you know if the information that you're inputting is actually having a positive output.
My experience has been it's difficult to measure what didn't happen.
Exactly.
Yeah.
Yes. And that's, I think, why it can be hard to fund for programs like Epic Girl that are working sometimes with the hardest to serve kids. Like I said, Epic Girl has served every young person that's been charged with murder in Davidson County over the past 9 years. And they're some of my favorite kids to work with. I will say every girl we had in the detention center that was bound over into the adult system still reaches out, sometimes for reasons that I don't want them to reach out. Like, can you put money on my books? But also it's just, I remind myself all the time that they know how to find their people. And you just hope that they'll continue to find positive people. And, Centoya Brown-Long works with us, and she's been a great teacher for us to say, don't give up on kids even when you want to. It's fine to put strong boundaries in place and say, this is a yes, this is a no, but make sure that they know that they can still come to you. That disagreement can be part of healthy connection.
Absolutely.
So we really feel like you're right. It's so hard to measure the things that didn't happen. And sometimes I just was saying to my friend James Bush outside, I said, sometimes I think, like for kids with significant adverse childhood experiences, you're looking at frontal lobe development not really occurring to closer to 30. And so it's just a mad dash against time.
I agree.
Yep.
Thank you.
Yes.
So you gave a number of 500. Where does those 500 come from?
We're seeing over 300 now from the Department of Children's Services.
Okay.
So when kids end up going into custody, there's an assessment center, 2 assessment centers. It's at any given time 48 kids, and then they transition out of there. So there's about 180 kids a year we see there. And then we're at the Juvenile Justice Facility, which is another 89 to 100 kids a year there. And we're there 4 to 5 days a week. Someone from my staff is there. So a lot, over 70% of our kids are coming from there. And then we're seeing anywhere between 70 and 100 at the alternative schools, but you never know how long you're going to have them. We aren't seeing the number of kids through juvenile court as we used to now that we've implemented diversion, because we're further downstream, like secondary to tertiary prevention. A lot of times we're not the appropriate contact for kids that are just having contact. And then we see 100 to 135 through the runaway program. So we provide 24/7 on call for the detention center to talk to runaways, because we know that they're at highest risk for delinquent charges and also for things like trafficking.
So it's kind of, I mean, I know the environment because I work in kind of a correctional setting. If you could give an example of saying this is a measurable success and impact from our program, although it might not be the rock star story where they made it out, right?
Right.
Do you have like an example of what that looks like from what you do with the youth?
Yeah, I mean, it depends on which location you're looking at. But I think my friend here, I'm sorry, I don't know your name, that said that it's hard to measure what never happened. But I will tell you, like, we had a girl in detention. Can I just tell you a story? We had a girl in detention. She came in with a serious charge, a murder charge. She was not bound over. She was very young. And she was not very trusting, especially of me. She and I looked very different. She was like, "Who are you showing up here?" And I would see him and be like, "Bye, love y'all, have a great week, see you in 3 days," or whatever. And one day she stood there very adamant and was like, "You don't love me. Why do you keep saying that?" And the other girls were like, "Yes, she does. Who else shows up here? What other agency shows up here 3 or 4 times a week to see us?" And she ended up being transferred to a facility, a behavioral health, like mental health facility. And I went to see her every week at the facility. It was about 40 miles from Nashville. And I would take her food. They would let me bring her food. And I'll never forget that one day the doors were closing to separate us so I could leave, and she was going back to the program. And she stood in the middle and she goes, "Bye, Miss Aisha. I love you." And I was like, "You love me now?" And she was like, "Because I know you need it. You mean it." That young person just graduated from Austin Peay State University. She says that Epic Girl was a catalyst and driving her to look at, I can continue to repeat the same old cycles, or I can do something different. And she's not sure yet whether she wants to get her master's in psychology or if she wants to be an attorney, because she says girls like her really need other options and need attorneys that are compassionate to girls that look like her. So I would say, like, she's one of the best examples of what it looks like to stay consistent. I also have a girl, Bella, who's 22 now, who's on our board and just went back to get her degree in psychology. And I tell her that when she's done, she can run Epic Girl so I can retire. So I think those stories are hard to find, because for every girl that does well, I have the ones that I still think about that are still gangbanging, that are still making videos, that are still stealing and doing all this stuff. But ironically enough, even those girls will sometimes reach out and be like, "Hey, I don't know if you remember me." They'll reach out to me or someone on my staff and say, "I need help with housing." So I think it's like planting seeds where they know where to come for resources. And also, I'll say one of the things that we're not good at in the nonprofit community is collaboration. And it's important to collaborate, but it's also important for consistency, because if a kid comes to me for one thing and then they come for another and I'm like, "That's not me, you need to go to this person," we aren't really establishing continuum. And continuum, whether people are in corrections or juvenile justice, is really the thing that drives meaningful change. Thank you. Yes, thank you. Yes, I appreciate y'all.
Thank you. Good afternoon, everybody. Thank you for letting me be here this afternoon. My name is Lee Gray, and I'm representing the REAL program, Reaching Excellence as Leaders, which is one of the 20-plus programs that the Oasis Center hosts on a daily, yearly, long-term basis. Since 2009, the REAL program has provided life-changing diversion from the juvenile justice system for approximately 800 of Nashville's most at-risk young men. We work primarily with young men of color who live in zip codes that the odds are not in their favor to move into a healthy, successful, long life. So that's really where we embed ourselves and hope to change the odds there for those young men living in those communities. We have a 9-week program. Sometimes it's 8, sometimes it's 10, based on the calendar and the calendar year, but we flex and make sure that the hours are complete all the same. And through that structured program, we use positive youth development, trauma-informed care, and our evidence-based approach is the teen outreach program, which we use across many of our OASIS programs. What the program looks like is we have weekly sessions 2 times a week. We host two sessions a week at Johnson Alternative and 2 evenings a week of community-based program with our grip court at the OASIS Center. Some of our focuses are service learning, family engagement and case management, college and career connections, and group mentoring, and a long-term program engagement. The goal is to keep those young men around our staff members and participating with our programming for the entire 9 weeks. We feel like that strengthens the relationship and strengthens the bonds so that when life arises after those 9 weeks, they know where to go, who to look for, and they don't hesitate to do so. Sustained holistic changes, that's the big goal, right? That's a 10,000-foot goal, and we hope that looks like employability. They're more employable, they're more aware of their career options, their family relationships are better or improving. They have a sense of belonging. They feel like they belong to their family, they feel like they belong to us, they feel like they belong to their community. And their positive identity. At the end of the day, self-esteem, feeling good about who you are and the direction you're headed, is a giant game changer. And we hope that all of these things combined simply don't lead to youth not reoffending, but that they are on a pathway to a healthier, happier life. Some of our community partners, Davidson County Juvenile Court, specifically the grip court, Chellis and her team are amazing, and we work really well with them. STARS, and I think you heard from James earlier, we work closely with their program, and we have young men that need those services. We take our young people to local colleges and universities. We just went to TCAT last week, and you'll see a picture here when they're at Tennessee Tech. Metro Parks and Recreation, Watkins Park is our home base for all things basketball and fun and exercise. Metro Public Schools, obviously, a lot of the young men aren't just coming from Johnson, they're coming from schools all around. So we try to build relationships with all of those places, but Johnson is our #1 MMPS kind of stronghold. We make a good team together. Music City Construction Careers, MC3, prepares young men for apprenticeships in the union trades. So we feel like that's a pathway to earning large sums of money and having a job for the rest of your life. Southern Word, they're at Oasis now, walking the young men through a poetry / literacy / now they're doing music. They're writing music as we speak now, so they are a partner of ours. And Born Gifted, it's a newer program to our portfolio, and Paris and his team work with to improve emotional wellness through a culturally relevant and a culturally founded lens. And they'll be coming on Wednesday. So according to the U.S. Department of Justice, Black youth are more than 5 times as likely to be detained or committed to youth facilities as white youth. We all know this. We're all working towards improving this. As of 2021, Black youth were 4 times as likely to be placed in juvenile facilities as their white peers. And the disparity hasn't changed much. Nationally, the youth placement rate was 74 per every 100,000 youth in 2021. The Black youth placement was 228 of the same 100,000, compared to 49 of their white colleagues, peers. In Tennessee, the Black youth placement rate was 129 compared to the white youth placement of 24. Again, in our city, a lot of the time the zip code does predict where these young men are going to end up by the time they're young adults. So we're really trying to change that and change the odds for those young men. Programming funding needs, according to the National Resource Center for Juvenile Justice, trauma-informed, culturally responsive, cognitive skill building and service learning activities like those that I just named that we do with some of our partners and also independently have shown effective behavior and change in adolescents and reductions of recidivism. So that's why all of those activities are the foundations for our programs. We do that with every young person we come in contact with. We try to hit those multiple times throughout our service, and also 9 weeks allows us to do that. Our current funding includes the Tennessee Department of Mental Health and Substance Abuse Services at 16%, United Way of Metro Nashville at 9%. The Tennessee Commission on Youth and Children Delinquency Fund is 3%, and unfortunately, our partnership with TCCY in this iteration is ending at the end of September. The organization works to get individual donations, and we also have a grant with Volunteer Tennessee to really focus on our service learning aspect of our program. So our current budget cap is $50,000, and that is to employ somebody to coordinate and work all the magic, build the relationships, talk to the families, do all the important stuff that I've been talking about, and even more. So our evidence-based practices, the REAL program is rooted in evidence-based practices that are specific to REAL, as well as other practices that are used across our agency. I talked about positive youth development and our teen outreach program. Positive youth development, the principles guide all of our work at the Oasis Center, and we focus on 4 areas: safety, belonging, empowerment, and generosity and justice. So everything we do is steeped in one of those impact areas, and we hope that we impact those each for those young people in a positive way. SAMHSA also provides 6 concepts of trauma-informed approach that we use, and it is safety, trustworthiness, peer support, collaboration, empowerment, and addressing cultural, historical, and gender issues. So there's some overlap. You can see how those 2 work symbiotically together. And community service learning. We need to get them connected to the community, and we need to teach them the importance of service and that the world is bigger than maybe what they see and what they know. So it promotes skill building. We let them choose. We give them voice. They dictate what they want to do, a sense of self and connections with others through voice and choice, meaningful service, structured reflection, and community partnership. So a lot. I'd say we've gotten really good about doing joined community service projects with the Grip Court, and so they see us all as a team and all working together for them. Program fiscal management. Our finance staff and program staff work closely together to ensure that compliance with all record keeping and other grant requirements, including staff timesheets, data collection, and our monthly reconciled monthly by the controller, and also through program leadership. So I see my staff's charges and how they're spending money. Jen, our VP, sees what I'm doing, and her supervisor sees what she's approved. So we really have a long chain of command, and you can see that our controller is kind of the center of all of that, and that communicates heavily with us, the payroll specialist and accounting assistant. So there are many checks and balances placed on to make sure that we are utilizing the funds the way we said we would and not missing anything that we should be doing that we're not. So program monitoring internally, I work really closely with the program leadership to make sure that on a daily basis, on a weekly basis, that we're doing what we need to do, that any surprises that come up are dealt with, that we celebrate successes, that we celebrate the young people who are really thriving in the program, and that we adjust. You know, young people's lives are always changing, and so if what we thought we were doing next week doesn't fit or doesn't appeal to the young people, we try to adjust in a meaningful way to make sure that, 1, we capture their attention, and 2, that we keep them engaged and we keep the programming relevant. Never want them to have their heads down and not want to be there. So we try to be nimble and pivot that. Externally, we work closely with Grip Court. We work closely with Johnson Alternative, and we share data as needed to make sure that we are all on the same page supporting the young men that we are seeing, and to make sure that we're all moving together as a unit and not as individual programs. We feel like that's more effective, and they have been really great partners in doing that. And I mentioned earlier, I'm in constant communication with Grip Court staff, with the youth case managers, the leadership over there to make sure that, 1, that the REAL programming is giving the young people what they need. Two, that we're meeting the needs of program staff as well, because they are also trying to move staff forward. And three, that we're all on the same page and doing this, again, I can't reiterate that enough, that we're doing this work together. And I feel like over the last couple of years, we've really strengthened those bonds and that connection with one another. Also internally, quarterly, we do scorecards. And again, my staff fills out their scorecard. We sit and go through it. My supervisor then sits with me, and it's an ongoing discussion about the data. Is it relevant? What are we seeing? What do we need to change? Why is this so low and this so high? So we're always doing that with the hopes that we are also improving the program along as we go. Volunteers, partners, always give feedback. It's welcomed. Schools, grip court staff, anybody. And also the young people. They have a voice, and we allow them to use it, and we allow them to, make sure that the program is meeting their needs. They don't necessarily want to be there. They're going through a tough time, and so the more we incorporate their voice and choice into what we do on an ongoing basis, the better off their experience will be with us. Data collection, pre and post surveys. So week 1, you take a pre-survey. Week 2, you take at the end of the program, you take a post-survey. And we try to capture some of the things I talked about earlier. The significance and belonging, the connection to the community, some of those things is what we're trying to capture there. How they feel about themselves, was the program helpful? Daily case logs, as our staff are working with these young people, that then they come back and they make sure that they are doing that. Also, a weekly progress report for those young men that are involved in the grip court goes out every Friday to the staff there. And we have a comprehensive enrollment form that captures kind of all the demographic stuff we need to know. Salesforce is our tool. It's locked behind firewalls for external folks. It's locked behind passwords for internal folks. And it allows us to do it anywhere at any time and update that information. Program evaluation. The highlighted parts are really what we're looking at as we kind of go through this process. I don't want to run too short on time, but you can see some of the stuff we talked about earlier that happens twice a week with each of the cohorts. Everything from service learning, family engagement, college and career, group mentoring, cultural enrichment, all that is happening constantly. And what we really want to see is an increase in engagement in program activities. Are they taking care of themselves? Are they participating? Is this beneficial to them? Things like service learning, self-care, and preparing them for work or life after high school. Self-report indicators, their attitudes, family connection, belonging is what we're looking for. And we follow the YPQA standards and make sure that those surveys are legit and relevant. Our immediate outcomes, what we want to see immediately upon program exit is a sense of connection, employability and education, improvement in family relationships, some resiliency, and a reduction in risk behaviors. Long term, we hope they don't reoffend, obviously, right? But really, we want them to be living productive, happy, fruitful lives. So that might be employment, that may be improvement in school, working towards more school, or really just excited about a career pathway in life moving forward. Program sustainability, we're always looking for money. We've got, for example, the MDHA Summer Youth Program to help improve summer programming, make that a little more robust. But Metro funding is extremely important to this program and its sustainability. But also the program is constantly looking for other monies coming in, other grant opportunities, donations. So if this funding were to be less or were to go away, the organization is committed to hopefully filling as much of that gap as possible so that our services can remain for the young people without being disturbed at all. Questions? I think I nailed it. Thank you all. Appreciate it.
Hi, everyone. Hopefully you can hear me well. All righty. I am Rokisha Bryant. I am the CEO of Pathways Kitchen, and I have with me Terry Sloan, who is our CEO. It's a pleasure to be in front of you all to request funding for our amazing program. Pathways Kitchen is on a mission to ensure that young people are thriving over surviving. We do this multiple ways. I will walk you through a little bit of our slideshow, if I could navigate it without scrolling too much. And so a little bit about our program. There's three major components. We are teaching young people culinary arts. We are making sure young people receive training and development, and we are also providing individualized success navigation. And so what that looks like is our young people are referred to us through various program partners. When they come to our program, they're ages 15 to 19. They've been impacted by the juvenile justice system in some capacity. Our young people are engaging in anywhere from 4 to 8 weeks of programming for 50 hours. And that's considered Path 1. Path 1 is where we do a lot of relationship building. We make sure our young people receive their food handler certification, and we're using the restaurant readiness national curriculum to engage them in areas of advocacy, communication, attitude, customer service, empathy, and personal responsibility. When they finish that 8-week program, they have a strong relationship with us. They know or not if they're interested in culinary arts, and they are receiving funding. So they receive a check for this. So they're earning while they learn, and then they get a choice. Do they want to stay on with us and continue to engage in our training and development and our culinary work opportunities, or do they want to go on a different path? And that's where we use some of our different partners, which will come up in another slide, and kind of get them into some other areas of interest. If they want to stay on with us, they move on to Path 2, where they are receiving a raise, they receive a promotion, and then they are able to engage with our culinary enterprises, where we provide full service catering. And so it's more earning while they learn. This is where we start to do more goal planning with them and really make sure that the young people are charting their own path forward. Our job is to help remove barriers through our individual success navigation, is to make sure that we're enriching their lives through resume writing, interview skills, financial literacy, all of these other things that we know they need to be well-rounded young people, and to really take the funds they're using to their full advantage through budgeting. There's a myriad of things that we do, but I think the biggest thing is we listen to our young people. We listen to them if we're moving too fast in the kitchen. If the content is too low for them, we bring it up. We scaffold and bring it down if we have to. We're very much conscious of the population that we're serving. We're conscious of their needs. And so we do use a lot of different evidence-based pieces. I think that's where we're going next. No, outcomes. I'll jump around, and the slideshow is just for, a visual for you all. But the main thing, and I wanted to say about our curriculum and our training and the way that we do things, is we listen to our young people. We partner with them. We don't do things to them or for them. We do it with them. And so that looks like us listening and finding out what they want to do, and we just simply help them. Some of our outcomes, because again, we have young people on 4 different paths. And so Path 4 is 8 weeks or 50 hours if it's over the summer, and the young people choose to stay on. We're serving 45 young people a year. That's our goal. And right now, about 76% of our young people who enter that actual beginning program, they complete the program. So they're getting the Serve Safe certification, they're getting a restaurant readiness certification, and they receive the check from us and a certificate of completing Path 1. Then Path 2, 3, and 4 is more milestone based. That's where they get the culinary work opportunities. And you will see that represented by the blue line. And so on average, out of the young people that complete our program, last year, 18 young people chose to stay in our program, where they earned additional average of $1,000 over a 7 to 8 month period. And that's, again, we're engaging them from start to finish with exposure to new environments, enriching opportunities, cultural environments, more work opportunities, but they're earning as they learn all along. Some of our outcomes, as you'll see at the bottom, 80% of our young people have improved their ability to manage their budget, to advocate for themselves. They're referring their friends to our program. They're working on their independent living skills. We use the Casey Life Skills Assessment. They're steadily improving on that. And we're talking about after just 8 weeks. 57% self-efficacy improved. And so these are the nuts and bolts that make our young people actually thrive. And over time, we're starting to track that. We have a young person that's been in the program now for 2 years. And so we're starting to do that longitudinal assessment. Again, the problem is, the need is huge. It's like I'm gonna. Yes, the need is huge, and we need your support in order to continue this great effort. I mean, we're talking about a training and development program that requires staff and well-trained people in order to interact with these young people to even get their buy-in. And then once we have a fork in them, pun intended, and they cross over to the next path, we have to have even more skilled employees. We have to make sure that we're able to provide them with those catering opportunities and all those other exposure opportunities. And so our youth wages, our staff wages, and our training materials is what the funds are used for. Thank you. As I tried to allude to earlier, everything is evidence-based because we are a trauma-informed environment. I am a trainer of trainers for building healthy brains, and it's embedded in the fabric of my whole organization. All of the staff are trained in trauma-informed care, positive youth development, multiple intelligence, some pieces of the teen outreach program that are out of the DCS contracts we have across the state. And so I used to train on that, and so training is my background. All of our staff is very well trained on these evidence-based practices and approaches and frameworks so they can interact with our young people in a culturally competent way. We make sure that we're, using multiple intelligence. Just being in the kitchen alone is body kinesthetic. This helps our young people learn and create those new pathways that may have been disturbed, because research does show that the young people are sometimes having at least 4 or more ACEs when they come through the digestive system. So we're actually decreasing those risk factors by increasing those protector factors just by the young people being in our presence. And we're at least, like I said, at least 50 hours if they're in our path 1. And then it just continues to go from there. Again, we're creating economic mobility. Life is not getting cheaper. We want to make sure our young people have a living wage. And that's where research does show that a living wage is where you're at the beginning of making something happen for yourself in the future. And so we definitely pay a living wage. And I think I'm running out of time, but I will let Terry move on and talk a little bit more about how we handle some of our fiscal management and some other things.
I won't take too long. This is not the sexy, exciting part, but we utilize gap-based accrual accounting, and we work with an outside accounting firm that handles all of our regular bookkeeping. I manage the relationship with that, and then we also work with an additional external firm that does an annual audit for us, and we were just signing paperwork for the audit this morning, so always doing a lot of stuff with that. Do you want to do this, or you want me to do it?
I checked the time, so I got at least a little bit of a beat. We're close to the end, and I can't wait to hear what some of your questions are. And so some of our output measures of course, we're always looking at the number of youth enrolled, and thank goodness we're at 45 a year, but I'm sure other counties have way more numbers. We have a huge diversion effort in Nashville, and so that's good. So we're keeping our numbers small so we can deepen our impact. We definitely are looking at how many young people have completed the program, how many young people. So first it's engaging them. Mm-hmm. Engagement is huge, and that starts at recruitment. And so we can recruit 100 and only 20 will show up. And so the numbers we're presenting for you is the ones that actually show up, and then they may show up the next cohort. And so there's a lot of nuances to that. We're definitely tracking how much the youth are paid, how many hours of influence we have with them. We're tracking exactly what type of activities they do, whether it's a catering event that's in-house, external, at a home, at an event. And so we're looking at all of that and trying to put all that information together to really understand what it truly means to thrive. That's the long-term goal. That's a part of our mission, and we're every day exploring that, but our young people are successful. You can tell by the smiles on their faces. They are academically improving by being in our program, and those other measures that I mentioned as well. And then these are the pieces of data that we're collecting on them. And again, we're constantly with our young people. And so I think the empirical evidence, just observing them, what's going on with you today, something has shifted in the way you walk, the way you talk, us actually doing that with them is huge. We even have what we call I see you meetings and let them know I see you. Good or bad, I see you. It's just pulling them apart, pulling them aside and letting them know we see them because we're assessing them all the time. Of course, we have to have some measures for all the different purposes, but this is really a different way of doing the work, and we want to make sure we're focused on the qualitative, not the quantitative so much. But we do have a satisfaction survey, and we're constantly tweaking the program based off the feedback from our young people. Some young people give us more in the kitchen time. We did that. We're changing the times of the day. And really, as I mentioned earlier, with success navigation, it's figuring out what works for this young person versus that one. One gets an early shift, one gets a late shift. It's a lot of individualized support. And so it's based off that individual, tracking them. And like you said, you get your license. Did you get your license 6 months later? And really holding them accountable. Probation officers, one probation officer said that their staff came and watched our young people in the kitchen and said literally they had never saw the young people act like kids. And, it's something that's simple, and so it's those things that you really can't quantify. You can't really write it in a report. You have to just be there. Again, I think I kind of went over some of these different examples because I'm ahead of myself on this, but we're doing ongoing monitoring. We're looking at everything. We're even looking at, okay, this young person is successful. Did they come in the summer or did they come in the winter? Mm-hmm. How long after them graduating from the initial path one was it before we got them a catering job? We're noticing the proximity with the catering job. We're looking at every little thing. It can be a lot, but we have some assistance from some Vanderbilt medical students. Vanderbilt, just not medical. Human development counseling students. And so we've worked with them to try to really think about what it means to thrive, really trying to figure out how do we look at a snapshot, pretty much a 360 interview of our young people. What matters most to us is what they say, what their family and friends say. Mm-hmm. And so, I think that is most of it. Again, we need to be sustained because we are a nonprofit organization. Some of our funds are offset because of our catering operation, but not very much. Honestly, whatever it is that it takes a normal catering operation to do, it takes us twice as much time and twice as much food because they're essentially practicing. And so we need funds for us to actually be in thrive mode as a nonprofit as opposed to being a nonprofit that's in survival mode, because that will directly impact our young people if we try to cut corners. Our goal is to continue to increase the processes for our catering operation because over time, like with anything in the restaurant industry, after about year 4 is where you start to actually see a profit. And if done correctly, we will reduce our ask over time of our philanthropic partners and individual donors. And again, our mission is to thrive as an organization, and if we are, then we know that our young people will, as well as our community. And so thank you for your time. We'll open up for questions.
I do have one. First of all, thank you all for being here, and I'm so impressed. I got a chance to attend an event where some students in a very similar program prepared the food, could describe how they prepared it, and it was great. And they were so proud. So I applaud what you're doing. The ACES program, the Building Brains, I know that's through the state. Did you all administer the ACES survey to the student and to the parent, or just to the student?
No, we hadn't.
Okay.
Administered.
Because I thought maybe that would be baseline data if you had. Have you all thought about administering that survey? Because I know it's not a long one.
Oh, no, it's not at all. It kind of empirically, I know, we know this, but we were just pulling off like a lit review. So it's based, I apologize if that was misleading. Just based off the evidence.
Okay.
Our program is evidence informed because we want to make sure we're in trauma informed environment. But I mean, we could do that, and we just try to not be so intrusive. Notice we didn't say case management, we said success navigation.
Yes.
And so we want to make it feel different, like a job for these young people, but just off conversation, I'm like 1 ACEs, 2 ACEs, 3 ACEs, 4 years.
Yes,
And
yes,
I will
because it
say-
is an intrusive survey.
I will just also add to that, for us on the side of the ACEs study, a lot of what we have learned from is the 6 protective factors that study identified. And our program is really designed to address at least 3 of those
okay.
6 protective factors, which is like creating economic stability for families, presence of a caring adult, and, oh, what was the other one? There's another, it was on the slides.
And I'm sorry, my eyes were jumbled, but even multiple intelligence. Having those caring adults around, making sure that we're buffering some of those things, the deregulation.
Oh, social emotional learning
Yes.
is the other one.
So are the young people that transfer from the training program to the catering side, is that the business? That's a business.
It's a social enterprise. And so without the support of the philanthropic community, we would not have that side. And so it's definitely, it's both. It is an actual business. It's a catering operation. We do generate revenue, but it's heavily offset because, again, we're paying the young people's wages.
Right,
But for
that's
the
what I'm
young
saying, their
people, yes,
staff.
It really functions as like a job, an apprenticeship might in
Exactly.
any other food service environment. They come
So-
into a kitchen and they're given,
They can use that as
things to say.
experience.
Oh, absolutely. We're
Right, so-
stacking a resume.
So that was my question, like, do you have, if you don't, you probably do, but if you don't, do you have numbers to say we have 30 youth working in the culinary industry in Nashville that came from our program?
We do have those numbers, but a lot of them work for us because we have our own catering operation.
Okay,
And so they don't have to, and so right now we have about 4 that have left us and went to other culinary fields.
I got you.
Yes. But we're using it as a real opportunity to gain workforce development skills, but they're actually working for us at the same time.
And I would say early on in our organizational development, because we're only 4 years old at this point, and
I keep
early
forgetting how
on,
young
we
you
were
guys
very quickly after they completed that initial training, kind of referring them into some external employment partners. What we were finding is they weren't ready for that. They needed kind of the continued wraparound support. And the restaurant space is not really an industry that had the time and the capacity to call us for additional support. So we learned from that we needed to give them more hours within our programs with the additional supports that we have before we then kind of pass them off to an external partner. So that's why that 4 number is as low as it is, because that's just, we've deemed that that's the number of youth that were ready to go into a more advanced environment without our additional support.
And about half of them aren't interested in culinary. Hence, pathways. Our job is to figure out what their path is. It just starts in the kitchen. But all of them fill out they're all considered 1099 contract. And so, like, it is official. We have so it's a job. I'm sorry if I didn't answer that first, but I wanted to make sure. But yes, it's a job for them, starting with they fill out a job application. Even if they're referred by someone, we still have them fill out the job application.
And the reason I asked that, because I come from a place, it's an interesting word called institutionalized, right? So I find that sometimes we can create spaces that people don't know how to leave. It's good for them, but like the ultimate goal of your program is to get people totally independent into whatever it is they're going into, correct? Okay.
Yes. Yes, we have a young person right now working at a restaurant, like 3 working at restaurants. Others have chosen to go on their path education. So we have some who are working in school. And one of the young people wanted to start his own business in photography. So every picture you saw, he actually took it. And so he was with us for 2 years, and he recently was like, I'm done, right? And so we're at a place now as an organization, if they don't tell us they're done, we're going to have to come up with like, you're done. And if nothing else, it's when they're 19. When they turn 20 years old. 20 years old is the cutoff, but we recognize it's a path. They have to figure it out. And so.
That's what I want.
That was a really, really good question. I thank you for asking, yeah.
We appreciate your time. Thank you.
Thank you all. Thank you so much.
Well, first of all, thank you guys for having us. We're excited to be here. So just to tell you a little bit about myself, my name is Caleb Rogan, as he stated. I'm a former police detective from Metro Nashville Police Department. My big deal with youth was being able to see them on a daily basis, and but having to switch sides to actually be a better impact to them was really my goal. So in 2020, I started a program called Rock Life Youth, and I left the police department to take this initiative of youth enrichment here in Nashville. And so the big thing that we're here to talk to you about today is Just Us. And this is our program, Just Us right here. It's a justice involved youth mentorship program here in Nashville. And so we partner with schools like Johnson Alternative Learning Center and Bass, WA Bass, who get a lot of students who've been incarcerated at school, arrested for various crimes. They go to these schools, and we have a mentorship program every week at these schools. And so the beauty of our program is that we meet them at these schools, but we also follow them out, and we have them until they graduate high school. And so we have them from the time they come into our program to the time they become adults. And so my wife here, she's when she found out about this initiative that we started here, she was all in, and she was like, "Hey, I want to be a part of this." And so she forced me to hire her to.
I volunteered the first year.
And so, but she's here, and she's really the one who really leads the program for us, and she's really passionate about this initiative. I'll let her go ahead and take over. Go ahead.
Thank you. Good morning. As he said, I am his wife, Agnes Rogan. I am a Nashville native. I am the oldest of 9 children. I grew up in the inner city with 2 high school graduated parents. So I know what it means to have a statistic placed on you and to not live to that expectation. Studies show that youth who have one consistent, trusted adult in their life, they are 55% more likely to be enrolled into college, 42% less likely to use drugs, 56% less likely to skip school. One adult, one relationship. That's the difference between a juvenile record and a college application. The sad part is, most of these youth, the one trusted adult never comes. And what we've seen is that many of these youth don't trust adults, not because they're rebellious, but because the very people that were supposed to protect them have hurt them. And we know what it feels like to feel voiceless or to feel misunderstood, but we also know what it feels like to have that one trusted, consistent, supportive mentor. That's why my life is different, because I had mentors along the way. And I did not become a teen mom. I graduated high school, the top of my class, got a full ride scholarship to Belmont University. I own my own business. I'm a hair and makeup artist. 1 out of 9 of my siblings who do not have a juvenile record, who did not have a teen pregnancy, but I had guidance along the way. That's why we created Just Us, because between the 2 of us, it's just us, and we like to partner together to show the youth what a household looks like, what a husband and a wife looks like who care about you. And I let the youth know that we advocate for you, we mediate for them. There's no one that's gonna go harder for them than us outside of their parents. We have had parents to call us and thank us for our work and tell us, don't think that what you're doing is lightly. My child has turned a 160-degree angle, which takes me to one of our students, Taye. We met him at the alternative school. He had an assault already because he was there, so he was in a physical assault in his high school, and the staff told us not to expect much from him. He was angry, he was shut down. His mom told us not to expect much from him. She said he doesn't trust adults. We were told that he was going to be one of our most troubled youth, but with the right mentor, 6 months later, Taye re-enrolled into his high school. His grades have excelled. He's joined the high school football team, and he has dreams to go to college. This is someone whose father broke his arm, and he's watched his father domestically assault his mom. And just with the help of one mentor who was consistent, who was steady, who was there to listen and check up on him and get him Ubers to church and make sure he had a Sunday dinner, this child has made a completely 180. And that is the work that we do, and that's just one of many. I'll now turn it back over to my husband to give you guys the logistics and the data.
All right, so again, this was our introduction. I meant to hit this button earlier. I'm going to go to the next slide. This was what she was covering. Here, our targeted audience and age group are, again, our high school youth, grades 9 through 12, and we actually have an 8th grade program that we just started this year as well. So 8 through 12, so these kids are going to be ages 12 to 14, 12 to 17. Most of these youth are going to be African American, roughly 70%, around 20% Hispanic, about 10% are going to be Caucasian and other. And so our 5 big pillars that we focus on, as you can see right here, when we get these youth, we tell all of our mentors, this is what we're going to focus on. We want to make sure they graduate. And so whether that's whatever support we have, whether it be ACT training or just tutors or anything, we want to make sure they graduate. Number 2 is career readiness, and so we want to make sure that every single kid that comes to our program has some kind of career path, whether it be entrepreneurship, college, military, anything and we bring people around them as volunteer mentors to give them insight. We had one young man just recently who wanted to be a realtor, and so we're currently helping him getting his real estate license as he's 18 years old. So employment, this is a huge one for us because most of the youth that we get, they're here because of poverty. And so one thing that we've done this year is we've started, we partnered with Power Youth, and so we're able to get these youth employment during the summertime. And so that's huge for a lot of them.
So we hired 27 youth this summer. They're working 20 hours for a fair wage. And what this does, it keeps them from being in the streets, being home idle, and having to do illegal things for a fair amount of money.
And of course, family engagement. Once you get the child, you also have the family. And so we're also involved with the families and character building. Again, each week we have one-on-one mentorship sessions with these youth. And so can you go to the next slide?
2 hours each session.
2 hours each session. So as far as how we reduce the occurrence of violence, we look on ourselves as more on the preventative measures. As you can see in these photos right here, one of our big things is really, other than mentorships and actually conflict resolution, and I mean, all of our mentors are trauma informed. We have trauma training beforehand. We want to focus on decision making and who they're actually hanging out with. But one of the things that we really focus on is really giving them a different sight and a different view. Because we figure if we can inspire them and give them a different mindset and goal set, then they can actually, there's an inspiration that comes with actually making the right decisions to have that path. And these photos right here on the bottom left-hand corner, on my left-hand corner, you're going to see these young men. They're at the Titan Stadium. We partnered with Turner Construction. We have a partnership with them. These young men got to go see young men that look just like them, African Americans, Hispanics, who didn't go to college but are owning their own business, and they're actually building $1 billion, construction piece here in Nashville. And they got to see that and take a path. These two gentlemen right here are NFL players, Bernard Pollard and Benny Cunningham, who play in the NFL, have the same backgrounds as a lot of these kids, and they come talk to them and say, "Hey, I was just like you. Didn't know if I was going to make it. Didn't know, I have the same background as you." And we want them to be able to see, a different side of life and see people just like them who've made it out. Our partners that partner with us on this initiative, this is strictly our Justice Initiative. This is Holloway Foundation, Memorial Foundation. We have NASA, Power Youth, and the two schools, of course, W.A. Bass, Johnson, and as I mentioned, Turner Construction and Metro Nashville Public Schools. Our program needs right now are going to be, we really are serious about having quality over quantity. Our program is growing. We get I mean, from these schools that we're partnering with, we get 30 new youth every semester because, so we're growing rapidly, and we really want to make sure that we're having quality mentors and have quality training. We don't ever want to get to the point where we're just focusing on quantity. We want to make sure that we're having quality mentors, and so just having the training piece that we can invest in to make sure that we're getting quality mentors, and also transportation. That's a huge part of our, what we want to focus on is career readiness and getting them in spaces and around people that can really give them a different side of life and different viewpoint. So transportation is a huge thing for us as well. Right here, we have our evidence-based practices. Again, our one-on-one mentorships, our positive youth development, of course, our career readiness model, social emotional learning, trauma-informed, and family engagement intervention. So these are huge on our part. These are, like I said, our pillars of what we focus on to make sure that we're getting to these youth. Fiscal management. We have, four things that we really hit home. We have our monthly financial reviews with our team, our accountant, our external bookkeeping. We have our board approvals, and also we conduct outside audit on our program every year. How we monitor success through our program. Again, mentorship logs. Every time we have our mentors go to these different schools, we keep a log on all these youth because we want to make sure that we're seeing growth, seeing different data that, whether it be attendance, whether it be, how their grades are coming along, character development, pre and post surveys that we do with our youth to make sure that the program is still impactful, whether it be with teachers, schools, and students. And so here's some numbers along the way. 90% of our youth, and one of our pre and post surveys stated that they, after this year, they have 90% of them said they had a trusted adult by the end of the school year, compared to 46% at the start. Going to the other side right here, this shows our visits to schools. We had over 1,000 visits to schools, 1,748 visits to schools for the youth in our program. 78 total youth are being mentored right now. And again, I have the demographics here. We're partnering with 14 schools because through our program, when they go back to their zone schools, we have 14 total schools that they're at right now. And again, we have 29 youth employed. These are two facts that we are proud of right now. 100% of our youth graduated in 2025 that were seniors right now. And then of 97% of our youth stayed out of trouble, didn't come back to, alternative school, no crimes. So we're proud of those two facts right here that we wanted to show you guys as well. Of course, as far as our sustainability, $600,000 came in for grants confirmed for 2024-25. In addition, we have strong volunteer school partnerships and community partnerships that we're proud of for Rock Life Youth. At Rock Life Youth, we're also human, so we do make mistakes. We spelled government wrong before we sent in our... And these are our types of funding. We have government funding, corporate and foundations that support us, individual giving, and then we have our fundraising types of funding. And so that's the end of our PowerPoint, and we'll open it up for questions.
Right. Well, thank you guys for being here today with us. Quick question, just for clarification. When you said we hired, can you tell me about that process? I know Urban League has a thing that they do where they'll fund companies and help pay salaries, but just explain what that means. And then explain, is the program really mainly on campus or on campuses, or does it just clarify how it translates out into community?
I can answer it. We hire the youth that we hire. Is that correct? So we partner with Metro Action Commission. And so what they do is they pay the youth. We interview the youth, and then we hire them to our location, and we give them, so we are basing it right now at Church on the Rock, Nashville. That's where our hub is, you would say. And so what we're doing with them, we're teaching them soft skills. We're teaching them how to be workforce ready. We are teaching them how to show up, how to leave first impressions, how to make eye contact, how to greet, how to shake hands, how to tie a tie, how to dress professionally, what's business casual. So we teach them all the things that they need to do prior to entering the workforce. But Metro Action, they are responsible for their payroll. So we calculate their hours, submit their hours to Metro Action, and then they pay them biweekly. And then with how we mentor the youth outside, we go to the alternative schools for 2 hours every week. So we are there Monday and Friday. And then we just added the 8th grade girls, so we're there on Thursdays for 2 hours. Once we take them through the onboarding process, we then assign a mentor to them. That mentor is required to touch base with them outside of the school, at least an hour a week. And so that could translate to a football practice, a football game, inviting them to a Bible study, taking them out for a bite to eat. But there has to be a 1-hour commitment that they reach out to that youth outside of the facility. And in addition to that, we also make sure to keep the open line of communication with parents. So we are constantly talking to parents. We have parents calling us when they can't get through to their children. I had a parent call me and tell me that her daughter was considering, that the school called her and told her that her daughter was considering committing suicide. So she wanted me to get a hold of her daughter, which I did, and the mom gave me permission to then pick up the daughter and spend that evening with her to talk about just kind of what was going on in her life, why was she overwhelmed, why did these feelings come, and we were able to resolve that and get Madison back on track, back working, reduce her workload because she was overwhelmed with trying to work and go to school, which most youth are having to do because they don't want to ask their parents for money. They see that their parents are already struggling and they don't want to be an extra burden. And so I helped Madison to make some decisions to take some of the weight off of her plate and focus on what was really vital, and to keep her mental health. So yes, we do, outside of the school, meet with them on a weekly basis.
I too thank you for being here today. And I may have missed this, so please forgive me, and I'm going to blame it on a senior citizen. Data collection tools. I saw the program that you all use to train your mentors.
Yeah.
Do you use any other program that provides data collection?
Yes, so we do SurveyMonkey.
Oh, okay.
We use SurveyMonkey. So before the students even begin with our program, we do a pre-survey, and that just basically asks the questions. If they have a trusted adult, do they have plans after high school and all of that. Then we do a mid-survey using the same system, just to track how they're doing. Do they feel like they've connected with their mentor? Is their mentor a good fit? And then at the end, before they re-enroll, or after they've re-enrolled back into their school, we do the post-survey. And that's where if we kind of monitor if the program is actually being effective.
And just to throw another quick nugget in there, as far as that goes, we also partner with NASA, who's very big on data. And so one thing they provide us with is a whole data department. So they help us with all of our surveys. They help us with our program evaluation by coming in and giving us tips along the way. So NASA's a huge data partner for us as well.
I agree. What is the time frame for follow-up after a young person completes the program?
After they complete it, as a senior graduating, what's the time follow-up?
Yeah. Do you all have like a 6-month, 90 days that you follow up with the student to see how things are going?
We are trying to touch base with them monthly, weekly, even after they're out of the program. We're never trying to stop talking to them. So we always keep the communication. Even if they're done, we're still, how are you doing? Are you employed? Are you enjoying where you're working? So we still, because it's so new, we still keep that 1 hour a week and monthly touching base.
And two, at that age range, many times it's more of a figuring out a career portion. So again, like we have one man who just graduated. We went to his house just recently for a party. He's going to the Army, and so it's all the picture up there. And so many times it's more of a career path ordeal where we're still helping them, getting them connections. Because every single mentor that we bring in, volunteer mentor, they're coming in from a career side of things, of different career models. And so they're connecting with these kids and giving out cards, business cards, follow me on Instagram. And so we want to keep those connections going so that after they're done with our program, they still have, a foundation.
Thank you. Yes, thank you.
Who clears your volunteers? Because I know that's a big thing with volunteers. Like,
Yeah, so we use TBI as far as background checks. We use TBI and fingerprints with the state as far as the background side of things, and of course, we'll use our own methods as far as hiring them and things of that nature. Most of our mentors are not coming in to be employees. We're reaching out to mentors to see, hey, handpicking them because of their expertise of what they got going on. But again, to get them cleared on the criminal side, we'll use TBI and fingerprinting.
Thank you.
Thank you.
So what time is, I guess I want to say good afternoon, everybody. I am Dr. James Bush. I'm a treatment director for Youth Overcoming Drug Abuse, a division of STARS Nashville. So let's get right to it. Program funding needs. Funding the Metro government helps to provide the following. Our program, we utilize the funding for second master level program, primary counselor. Why? Because those individuals have been through a graduate program where we believe that it would have had the training and the skill base, utilizing evidence-based principles and practices to help service our clients as well too. Also, we provide light snacks and refreshments for participants. They're coming straight from school. Adolescent community reinforcement approach has data and research information that shows that getting that glucose running around the time of maybe 3 to 4 is helpful when you're trying to retain certain information. All right. Bus passes for students who need transportation assistance. We try to meet our clients where they're at. Unfortunately, some of them do not have access to cars or they're not autonomous. So we provide bus passes to them to be able to get to the program when needed, as well as get back home. So I'm going to move to the next slide. So how the program promotes equity in the community? Well, one of the things we do is we try to have services that meet and break down all types of barriers, gender inclusive, as well as those of speaking different nationalities and languages and whatnot. Sometimes we've been in group where we've had a loudspeaker or a phone device, and we've been able to have a translator on, and we'll say something, he'll say something back. It's the funniest thing you can watch, but guess what? It gets the job done. It works. And so the clientele, they come through the program, they're excited, they've been able to, understand some of the things that we're saying. I'll tell you another story. So we had actually a parent night. Get this. We had a parent night, and we had one of our translators that was at this parent night. Most interesting thing is that we had someone from the Hispanic community that was there as well, too. Apparently, our translator wasn't doing a good enough job. So what did he do? He said, excuse me, sir. Man, he became the de facto translator in that moment. Very interesting, a sight to see. But guess what? It worked. And we enjoy those moments because those build experiences, memories, that's buy-in of the family practice with us. So, our program partners, Davidson County Juvenile Court, Robertson County Alternative Learning Center, Department of Children's Services, State of Tennessee, Epigirl, and Williamson County Juvenile Criminal Court. We've been having a successful relationship with many of them over the years, where they referred different clientele to us. Again, we work throughout the state of Tennessee, but unfortunately, some of them cannot get to 1704 Charlotte Avenue North on a continual basis. But we do provide telehealth to some as well, too. So that is a thing that we do. Now, let me tell you a little bit more about the program. It's a 20-session program. It's intensive outpatient, level 2.1 on the ASAM practice criteria. What that means is that it's a little step higher than the outpatient program and a step under than a partial hospitalization and a residential program. What we try to do is provide an intensive, safe, and invigorating atmosphere for individuals who are suffering from substance abuse of some sort. That can be alcoholism, that can be polysubstance, that can be cannabis use disorder. The list goes on and on. But the thing is that it's intentional. We provide it 4 days a week, throughout the process for 3 hours. Do they stay all 3 hours? Sometimes they do, sometimes they don't. But what we try to do is we try to make sure that they have something that they can take home with them. Each session is based on evidence-based information that I'm going to show you in the next slide. You know what? But I also want to do this though. So a little teaser, because not many people know this, is that is the inpatient, intensive outpatient program of this. Remember, I said it's a step higher than outpatient. July 3rd of next week, we will begin providing services in juvenile detention, 100 Woodland Street. And that is, delivering services on the same evidence-based matrix curriculum to those pods that are in there. So that's something we're definitely excited about. What we realize is that a lot of our referrals do come from juvenile detention. So what it is, might as well get ahead of the program and this same outpatient program is similar to what we do in Robertson County currently. Hazelden Matrix Model. You can find it on SAMHSA in its NREPs. Hazelden Adolescent Occurring Disorders. Also something that's NREPs. Adolescent Community Reinforcement Approach. Again, why we give snacks out the way we do, it's because of that data right there that says we should. And cognitive behavioral theory. What does it say? Change the thought, change the action. A lot of the times what we're trying to do is get kids to think outside the box, think outside of their norm. You know, I understand some of the things that you've been going through. I understand some of the gang activity you've had. But what about if we present you with this healthy alternative, what it could potentially do? I understand that you may be on Vyvanse or Adderall or Ritalin or maybe Strattera, but Strattera is not stimulating. I understand those things, but I'm looking to give you healthy alternatives so that you don't have to go and smoke copious amounts of marijuana. Those are some of the things we're looking for. Program monitoring. My fun part. We utilize audits following our progress, patient progress. Conduct 6 months using the Adult Addiction Severity Index. But guess what? We have a teen version that is evidence-based and is reputable as well too. And so what happens, that can happen even via telephone interview, if we can get a hold of them, or that can happen in office. The main thing is that it gives a snapshot of the person in the beginning of treatment as well as the end of treatment. The numbers don't lie. You know, if you've been out of detention for a significant amount of time, that's great. If you haven't used as much in the beginning as you're not using during the end portion, that's great. So we can actually track the numbers and see what's actually happening with that individual. Potentially, if you're in school and you've had a lot of suspensions, you've had a lot of disciplinary action, then all of a sudden you're in school, you're going to class, you've gotten involved with extracurricular activities. Potentially you're actually going to work now. We help you get a job at a Burger King or a Sonic or et cetera, et cetera. That's how we can track the progress of things actually taking place that are beneficial, that are hopeful. Here's where they talk about money, my favorite subject. Top finance team has years of experience, fiscal management, periodically audited. We have a uniform guidance audit as well too, no finding, and as well as a clean audit from the Metro Finance Office. I ran through that one real quick. Now, data collection. Individuals are assessed using, again, the Teen Addiction Severity Index, standard evaluation tool prior to admission. Remember, I said it happens in the beginning, happens in the end. But guess what? There's something else that happens as well, too. We do a Socrates 8D that happens in the beginning of treatment as well as at the end of treatment. One of the things about the Socrates 8D is it assesses readiness to change. So an individual, and they have different, so the 8D, they have that, well, not to nerd out on you too much, but they have Socrates 8, 8D. 8D is inclusive of substance abuses as well too. It's just instead of just alcoholism. But the point being is that it gives us information, okay, that person, they came in, they had this potential mindset when it came to substances. Through the curriculum that we've given them over those 20 sessions, we're hoping that we've increased more of motivation for them to be able to excel and soar while they are away from us. And so with that also too, we have discharge teen ASI, which I told you about earlier. We have the summary and the aftercare plan, but also we have a client survey. Those are fun because sometimes kids, what they'll do is, but every now and then, you'll have one or two. They're just like, I really enjoyed the program. They'll write feedback in there. And also, too, their parents will go and push feedback in there and have some numbers on that as well, too, in the coming. TASI is Teen Addiction Severity Index, Client Satisfaction Survey. In the end, we will discuss that. Making kids feel safe, making them feel heard, making them feel connected to their communities. So let's go to the outcomes of all this. We believe that 65% of youth who complete the program will show a reduction in the rate of reoffenses with juvenile criminal court. 65%, at least. We believe that 70% of youth who complete the program will have increased connection to people, places, experiences that support healthy development. That could be marked or monitored. That's the word I'm looking for. More connected to your family, more connected to your community resources. Maybe you're looking to work at Watkins Park. Maybe you're getting resources. Maybe you're looking to get connected with a program that's in the Oasis Center, College Connection. You can kind of find that thing out. Maybe you're looking to kind of find some charity work, whatever it is that we're looking to provide those resources with our case managers to help them feel more connected so that they can do more things during that time period than just be stagnant and potentially get back into trouble. 70% of youth who complete the program show an increase in cognitive skills and knowledge related to healthy alternatives. What I like about this is that word cognitive is cognitive reframe, being able to change the thought so we can change the action. If I'm able to see that, now you up there rushing me, brother, you rushing me. But if you're able to see that, okay, I don't have to smoke marijuana. I don't have to go in areas that smoke marijuana or use substances or anything along those lines. I can use healthy alternatives to do such, man. Those things are beneficial. Why? Because they promote sobriety and my recovery moving forward. Highlights, 2023-24, Yoda, we saw 43 clients, 80% of had an increase in scholastic activity. They went to school. That's a great thing. They maybe played sports. It's another good thing. Some of them went to work. Another great thing. 85% of participants reported increased knowledge related to the dangers of alcohol and drug use. 21 clients graduated from the program. Program sustainability. We have diversity of funding sources, evidence-based prevention. We are diligent to ensure the agency maintains a healthy balance of unrestricted cash on hand, and the budget is monitored throughout the year, and adjustments are always made when we need it. We talked about the surveys. Clients say that after receiving Yoda services, 90% of clients reported they were better able to control their life. 92% said they're better to deal with the crisis and situations used to be a problem. 85% of them reported that they have a better understanding of their addiction. Many of them do not believe that they are actually addicted to anything. We're going to change that. So, and what did the parents say? The parents said that 100% said the Yoda staff showed concern for the child and family. 100% of the parents reported that the Yoda staff was helpful. Are there any questions?
Thank you for being here today and presenting.
Yes.
A couple of questions. Back earlier on, you said there's a 3-hour session that they attend?
Yes.
But you said sometimes they don't always stay for the 3 hours. Is that not mandatory in the program for them to stay for those 3 hours?
So what we do is that there's a 3-hour session that's allotted for the program.
Okay.
And so what happens is that, you have your first hour, you got to give them a break, So give them 15 minutes, 10 minutes. Stretch your legs, get a snack, walk around, And then for every hour or so like that, we try to make inclusive in that. Why? Because if, you're going to kind of lose their attention. So sometimes what we'll do is, all right, fellas, we're going to do this. Let's use this module, let's use this program. 2.5, can we do that? Let's do that. You go see your primary counselor for what do we call that? Treatment plan or biopsychosocial or any other thing. The point is that we want to keep them engaged. What we found out is about young men being stagnant in those type of environments is not good for retention. So what we have to do is we have to make sure that we keep them engaged. Whatnot. We give them something to look forward to when they come to the program. It's like, because if I tell you off the hand as a young man, hey, you're gonna say 3 hours, well, I ain't coming today. But guess what? It's supposed to be 3 hours, but this is what we're gonna do. And that's the buy-in.
Okay.
You're building that connection. You're building that rapport with them.
Okay, another question, just a second ago, you said there were 43 people in the program and 21 graduated?
Yes.
So the ones that didn't graduate, do you continue on? Do they continue on with the program until they graduate, or they're just?
Oh, we're non-punitive.
Okay.
We're definitely non-punitive. And so there's individuals that have been a part of our program that have been there for about 6 months. There's individuals that have been there for 9 months or whatnot. The point is that just because they go and they can't give us a negative screen, that means that there may be something that they are missing that we are going to recover in the curriculum that we have. And so that's beneficial for us and it's beneficial for them because it shows us how can we better serve you, and it shows them resilience. Thank you.
Good morning. Thanks for having me. Monica Schmidt with Tennessee Voices. I'm standing in for Kristen Davis, who had originally was on the docket to present. But I'm the VP of Programs here at Tennessee Voices. So this is REACT is one of the program enhancements that we're asking for. So REACT is an accountability, control, transformation, anger management training program. Currently, we have a program within Juvenile Detention Center here in Davidson County where we provide a family support specialist within the courts. Family support specialists, if you're not familiar with them, are a certified peer family support specialist. So that means it's a family member of a child who's been diagnosed with a mental illness. So they have navigated the system working with a child who has a mental illness. And so we employ at Tennessee Voices family support specialists to work with those families that may be coming through the juvenile court system that may be identified as having a mental health need. So our current program is called Family Support Specialist in the Courts. We work in Davidson County Juvenile Court System. We target families between the ages of 13 and 18 who are juvenile justice involved or just maybe juvenile justice touched. Maybe they're not fully involved yet, but they could have been referred to the system. We provided 20 juvenile justice involved youth during the 1-year grant period. So our focus of what we would like to do is currently we serve 70 youth across the year who are referred by detention center who might need support getting connected with mental health resources in the community, any other supports, housing, any other additional supports that would be needed. This program that we're proposing would provide an additional support of anger management classes. So we can provide anger management to the teens or youth, anger management to the parents, or any of those supported systems. We would like to expand our services across the Davidson County Juvenile Court Departments and provide anger management training. Hopefully this will give families the resources to reduce court recidivism and then help families address any anger issues that might pop up. Currently, Tennessee Voices, just in general in Davidson County, also partners with Youth Villages, the Oasis Center, Meharry Medical Center, STARS programs, any other youth-serving agencies, Metro Nashville Public Schools, any of those services, DCS. What we would like to do with REACT is train our current family support specialist that works within the community and within the court system to become let me check my notes, certified anger management specialist. So what this means is they would go through a course, get certified as an anger management specialist who could then step in and train parents or the teens, youth, whomever, the classes. So the funding would provide the training to that person, purchase the anger management workbooks and duplication licenses for those participant materials, promotional materials. So what we would like to do is, beyond the current program that we're in, enhance it to further service any youth within the juvenile justice reform system, and then any staff support costs that would be affiliated with that. It is an evidence-based program, so the system that we're looking at utilizing and getting trained in is through Growth Central Training. So they provide an evidence-based curriculum that provides anger management. There's 3 platforms. When I was doing my research, pardon me, take my glasses off. So there's a system that we can target adults, so that would potentially be used for the parents if necessary. There's a system for kids and teens, so it's a curriculum that can be targeting the teens as well. And oddly, or not oddly, I'm sure you guys recognize this, there's one also targeting young children, so elementary, early middle school age as well. So depending on what needs arise, we do have access to train and provide the curriculum across a wide range of ages for those services. But it is evidence-based. A little more about that program. So you get a certification. The program really targets mindfulness, emotional regulation, communication skills, conflict resolution, co-regulation skills. I think farther along in the slides, it kind of speaks to the length of it. But it's a 12-week 12-module training. You could lump that however you needed to based on what the families are aligned to. It is a group-based curriculum. I haven't done enough research, but I'm assuming it could also be done individually based as long as the family is willing to integrate and use the modules in that way. But our goal would be to target from a group perspective. We all know kids learn better in a group setting and can lean into their peers to try to learn a little. The fiscal management, so Tennessee Voices has a cloud-based accounting software system. I wish I knew what the name of it was, but I do not. Our CFO is not here. But that's where we manage all our tools that we use. We invoice, so the program manager creates an invoice based on whatever services provided within the month. They issue the invoice to the finance department, and then they would send out, fiscal department would send out to whomever is the financial property or financial person responsible for paying those. We prepare budgets annually for each program. So if awarded this, we would, I think I did a preliminary budget for this one based on needs and things like that, but finalize the budget and send that back out to you guys based on what the presenting, how we would utilize the funds for that. TNV adheres to any generally accepted accounting principles and uses the accrual basis of accounting. I'm guessing our finance people probably put that in there. Program monitoring, so we do monthly reporting, our QPIs, we kind of follow the quality measures based on what we would establish. Monthly reporting for the program tracks progress towards the goals. We do a CANS assessment, a child and adolescent needs survey to determine what needs the family has. We also utilize, we do the CANS, but we also use the DLA, daily living activities, so that's also an evidence-based tool to determine what needs the families have. So either one of those tools could be used. This is what we currently use with the families that are presented to us in the court system. So we do that to see what additional needs they may need beyond just mental health supports. If they need housing support or, food resources, anything like that, this DLA or the CANS would kind of tell us where their needs are. Program data collection, we collect numbers from monthly reports, so the staff provide a monthly report up to the supervisor, who then puts that in our QPIs. Staff will submit activities to Tennessee Voices via monthly report. What we would like to track based on this additional program is the number of people referred, the number of people that we put through the training, number of completions per month, so how many actually successfully completed the class, and then any Davidson County Juvenile Court programs that received program information. So one of our goals would be able to disseminate information further so that we can start spreading beyond just juvenile court. Who else could utilize this service? So who else did we talk to that we could help potentially engage youth in? Program evaluation. We will utilize a satisfaction survey and monitor programs or progress through the program. Pre and post surveys will be administered to determine the effectiveness of anger management training. We'll report monthly on the number of times the program is shared with juvenile court staff. So again, that's just a survey we would administer out. And then also check progress on recidivism based on if we did it's not in here, but we could do an annual kind of recidivism follow-up to see if they've had any further engagement with juvenile court post receiving the class. Sustainability, we are a nonprofit agency, and so we are grant funded, but also Medicaid funded, insurance funded. So this program is not necessarily a billable program, so we lean heavily into grant funds to be able to sustain the practice of it. We, as an agency, for many, many years have run different kind of parenting classes, Teen Connect, nurturing parenting. So we've often leaned into the Department of Mental Health and Substance Abuse, Department of Human Services, OCJP to kind of support and fund us through other different avenues to provide different services this way. That's it. What questions do you guys have? Maybe I can get us back on track time-wise.
Good morning, and thank you for your presentation. I'm glad to hear that you all are using a lot of evidence-based strategies, so your data becomes more reliable. I do have a question about the parent engagement. Is there a survey where you can measure the level of parent engagement?
So we could, we currently in other programs use what we call the caregiver strain questionnaire, which kind of measures the strain on the parent pre-engagement in a service, engagement of a parent post. We're a family-led agency, so our goal is to actively connect and engage the families accordingly. So I think if we don't have one, it's an easy survey to create based on what the data you guys would be looking for. So how engaged were they previously? All that, I think that would be great data to look into. So yes, it's not prescribed in here, but yes, I think that would be an easy thing to add on to just track the data to see.
And I also noticed that your program evaluation is basically quantitative data, where you're just gathering numbers. And so having a parent engagement survey would certainly give you,
and the parent
like, where did they start, where were they when they started, and where were they now that...
So the parent strain questionnaires are we use it currently, we'll do it see where the stress of the parent is prior to engagement in any of our services. Facilitate through the service, facilitate to the program, and then do the post questionnaire to see if the parent is expressing a decrease in stress or an increase in engagement. I think part of that questionnaire may actually be around parent engagement. The reason I'm not 100%. I remember looking at one within the past year or two around engagement and around parent involvement. It could have been correlated with another program that we use. However, it is a survey out there that could be used to kind of just gauge how actively engaged the parent is prior to, based on their stress level, and then doing this, what would their engagement look like?
I just have one more question. Other than self-reporting, is it anything else you all track with the parents?
It's just self-report.
Okay.
Yeah, great question. Thank you.
Thank you.
What other questions?
So with the training program, how many people?
So our goal would be, and I probably skipped over it, let me jump back here.
I know it's 20 youth, but
20
but the adults that are getting the management certification, right?
So we have two staff. We have a supervisor in that program and then one FSS working in that program. So it'd be two staff that would be trained in that program to service those 20 youth.
Okay.
Yeah.
And then is there ongoing training?
There is a recertification process. You get certified for a year, and there's actually two certifications. There's a certified anger management specialist 1, and then you can do a secondary class as a certified anger management specialist 2. So depending on what the two levels look like, we could look to do the level 2, and then just maintaining that certification annually.
Okay, thank you.
Yes, ma'am. What other questions? Wonderful. Did I get you guys maybe a little back on track?
Thank you.
Thank you. Yes, I leave this as it is.
Hi. We're really excited to be here. As he said, we are from Valor Collegiate Academies, which is a 3-school charter network here in Nashville. We're right off of Nolensville. We have 2 middle schools, 1 high school. I'm Ashley Smith. I'm our Chief Culture Officer. This is Sahara. the director, Compass Care Team Director. Yes, our wonderful, fabulous director of the Compass Care Team. So we're gonna pitch our Compass Care program to you all. We're really excited about it. It has done wonderful things for us at Valor. So our Compass Care Team, or Compass Care, aims to serve middle and high school students ages 10 through 18 who are chronically absent, disengaged, or at risk of juvenile justice involvement. We want to focus on youth attending schools in South Nashville's Overton cluster. We are in South Nashville. A lot of the students who attend our schools would be in the Overton cluster if they weren't attending our school, which is the primary reason why we want to focus on the Overton cluster. Each student and family participates in a 10-week intervention cycle. That includes biweekly family check-ins. They each have their own sort of case manager, and so they're checking in biweekly with the case manager. The students get check-ins weekly. There are internal team reviews and ongoing school and community coordination. There's also follow-up. So once the 10-week program has ended for them, there continues to be follow-up, and re-engagement supports are available as needed. Some of the services that are provided include strengths-based case management. So the case manager is very focused on that individual student. We don't take a one-size-fits-all approach. It is certainly very, very much about the student and their family. Personalized action plans, family engagement and coaching, navigation, support for school systems. We have a very large immigrant population at Valor, and a lot of our families, this is the first time they've ever interacted with an American school system, and so we are there to help them navigate school systems, as it can be pretty difficult, but also mental health, legal aid, and basic needs, especially with the way things are right now. A lot of our families are in need of all of those supports, and then our immigrant and non-English speaking families often have the hardest time getting those supports. We also provide crisis intervention and attendance monitoring, since attendance is a big part of how students come to us, and connection to pro-social activities and community-based supports, because we do understand that it actually does take a village. This can't just be all on one person. CCT, the Compass Care Team, aims to reduce the occurrence of youth violence by providing intensive wraparound support to students who are chronically absent or otherwise disengaged. These are key indicators which are linked to future involvement in violence. We use a multidisciplinary team approach. We build strong relationships with students, their families, and we address underlying drivers for the chronic absenteeism or other indicators such as trauma, instability, and unmet mental health needs. And then the goal, of course, is to re-engage them in school and community life. Over the past 4 years, CCT has demonstrated success in increasing school attendance. We've shown an improvement in family engagement at the school level and connecting youth to pro-social supports. These factors are proven by research to reduce the risk of violence by fostering stability, accountability, and belonging. Because we intervene early and consistently with high-need students, our team not only disrupts potential pathways to violence, but also helps young people build the capacity to thrive. All right, now it's time for the video. Play first.
The Compass Care model started in 2021 with Valor as well as Tunica Family of Agencies. With that collaboration, our community saw that there was a need to support our students and families who've been impacted by the pandemic. And all of our students and families have been impacted by the pandemic. I've been impacted by the pandemic. And what that looks like now is providing support in unique ways that go beyond the school walls.
Bueno, el ser parte del Compass Care es para mí una bendición. El equipo, el señor Gustavo, a mí me hizo sentir como un hermano para mi hijo. ¿Verdad? Me dio esa confianza, me ha dado ese apoyo, porque para mí como madre soltera ha sido muy difícil porque no tengo el transporte de la escuela para que recoja a mi hijo. Él ha sido muy atento, muy amable en apoyarme en ese aspecto de llevar, de traer a mi hijo a la escuela, y para mí ha sido un gran apoyo.
The way we support families within our program varies depending on the situation, depending on the student. We can support families by providing transportation sometimes in the mornings, or by having moments of connection with our students when they feel anxious. We also support families with translation when there's a lack of communication between the school and the families. Not only someone who speaks their language, but also someone that looks like them and someone who is interested in serving them. It just closes the gap that exists sometimes. And it also gets rid of the idea of a savior trying to rescue them from something, because for our program to exist, we must take a sustainable perspective and to build something that lasts beyond our roles. And so that was really important for me to keep that in mind when serving our community.
My family counselor helped me out with he checked in with me and would ask questions with me. Even if my grades were good, he'd ask me how I felt. I feel like they want to help you with whatever you need and not what they think that you need.
My family partner checks in with me once a week. We talk about how I can achieve my goals and become more focused in my classes. I like how my family partner really listens to me and I feel like they care for me.
What brings me joy is connecting the families back. I think sometimes in the day-to-day families, parents get into provision mode and kids get into school mode, that they forget the relational aspect. So what brings me joy is talking about the positives in both settings of hey, your parents are providing you a roof over your head and you're doing your job as a thank you by getting the good grades that you get and trying to do your best at school. But then let's talk about the relational aspect and let's talk about the sitting at the kitchen table and having conversations. When families are able to do that and see the joy in their faces of being excited that their kid is sharing yeah, I had a great day or I had a bad day, outside of just fine, that brings me joy.
The heart of the Compass Care model is learning from the family and from the community what's needed. And as a team, we want to make sure that we are on the family's turf and bending to the needs of the family.
What brings me joy in my role as a family partner is the fact that the small things that for some people might be insignificant are the things that make the difference. Having someone that tells you, I believe in you, I see you, I hear you, there's a future that's waiting for you, there's something exciting that happens after you graduate, or simply you matter. You matter, and I want you to come to school not only because I want you to do well, but also because I believe in you. And I believe that you can bring impactful work into your community as you go on your educational journey. So that brings me a lot of joy, the fact that I can do that.
Right. All right, so I am Sahara Evans, the Compass Care Team Director, and the video was meant for you to get a little bit more information about our program, our services. Sorry, as you can see, I move around when I do presentations, and I need not to do that. So that we provide services to our students and families from what they need in an individualized way. So 60% identifies a decrease in days absent from 2021 as when we started our program to 2025. Over the past 4 years, students participating in Compass Care Team experienced a consistent decrease in the percentage of days absent across all cohorts. We see a success about 60% of students supported through the Compass Care Team improved their attendance during the intervention. Sustained impact. What that looks like is CCT delivers continuous measurable improvement in school attendance. And then a testimonial from a parent, nothing short of a miracle. A parent identifies, the confidence that my family partner gave my son is nothing short of a miracle. I hope every student who needs this program finds it. And then lastly, in reference to our 10-week intervention, after just 10 weeks, wanted to put a little testimonial of a student. DVM went from missing 60% of school. So this student was not attending school for quite a while, unfortunately. After
After conversations with the family, and actually his mom was the parent on the video, he missed a substantial amount of instructional time. And after engaging with our program, he was able to engage in class, staying out of trouble, as well as he was able to graduate with us, which is amazing. I just want to put a little bit of impact data as it relates to our services. So as we mentioned, we started our program in 2021 in reference to the pandemic, and an impact data slide around what our progress has been. So each year we've seen a reduction in days missed with our services that were provided. Some program partners. Because our services are individualized, we have program partnerships with multiple partners within Nashville, just based on the family's needs. So that's legal aid, Metro Office of Family Safety, Napier Clinic. There's other clinics as well that we refer families to that need additional support, or medical support, dental hygiene, mental health support. Mental Health Co-op has been a great resource for our students and families, as well as the store to get groceries. Some of our families fall short sometimes and need groceries as well. Those are just some of them to mention. And then, as I mentioned in the video as well, Seneca Family of Agencies is a wraparound program in the Bay Area where we started our program, and we partner with that program as well. They've implemented our program in 2 schools in California and then 2 schools in Washington State now. Program funding. The Compass Care team currently is funded through an EIR grant, which supports the work that we're doing at Valor Collegiate Academy. However, we want to expand our work within the Overton cluster, and which is why we're seeking funding to be able to do that, to work with more students in the community. Philanthropy, as well as CPF funding, will allow us to expand this proven support within the Nashville community. And some evidence-based practices, wraparound services, as we've mentioned, just to meet the complex needs of our families, trauma-informed care. We have several trainings within our community that team members go through, as well as students as we talk about our check-ins and other services within the community. Multi-tiered supports, as well as protective factors framework, emphasizes on empowerment and connectedness. We want families to feel like they're part of the decision-making, and that we're telling the families what to do. But if we're really saying that they're the experts, we want them to be involved in that process and the skills to be able to do so. Our physical management, the Compass Care team managed through a collaborative structure, budget oversight, dedicated grant tracking. Funds are tracked using segregated budget codes. We work really closely with our finance team to make sure that our expenditures are coded correctly, that we are on target as well. Program data collection. Key metrics collected are attendance rates, behavioral referrals or disciplinary actions, family engagement, participation in meetings, action plan progress, academic performance, data collection tools, school information. We use Infinite Campus, Kickboard, which is our behavior management system, and Illuminate, which tracks our academics for our students. Internal Compass Care team dashboards and progress trackers. We have case notes. Our family partners write an intense amount of case notes, and care plans as well that are collaborative with our families. Frequency and oversight data is collected weekly and reviewed by the Compass Care team during case management reviews, as well as during real-time decision-making if we need to alter the program or if it's not being used with fidelity or quality in general. Our program evaluation. As I mentioned, mixed methods combine our qualitative and quantitative. Qualitative information is testimonies are like near and dear to our heart. I'm a parent. Everyone on the team, they don't have to be parents, but they are parents. And just knowing that families don't feel like they're alone in the process is something that resonates with me a lot as we get through the struggles and obstacles that families have within our community as well, our young students as well. It's a 10-week cycle and monthly and quarterly reviews conducted by the Compass Care team director, myself. Some methods, as I mentioned, weekly check-ins, case management, family engagement, coordination, and referrals to services. Sustainability, our program is ran through an EIR grant that we were awarded based on our impact and our services, and that's for our staffing, training, and data systems. We also get some funds from private resources that are able to provide small relief funds to families, as well as youth incentives and development, and then mental health support, which is pretty costly as well. And lastly, prevention starts with presence, as we mentioned at the beginning of our presentation. Thank you for your consideration. And together we can ensure students are seen, safe, and supported before they reach a crisis point.
I'm Sahara Evans, the Compass Care Team Director, and Ashley Smith, our Chief Culture Officer. Come on over.
Just for clarification for me, the resources that you're seeking, will that resource go to Valor Collegiate? Where will the resource actually go, and specifically, or is it, because I know it's not a standalone program, and this sounds like a big organization to me, but the specific resources that you're seeking, explain how that works, or where does it go?
No, that's a great question. So we want to use those resources for staffing to work with additional students in the community. So while we would employ that person will work with students in the community. So within our application, we mentioned that we would like to work with an additional 25 to 50 students in the cluster.
Okay, so it says with high-need schools within the Overton cluster, which are the high-need schools? Have y'all identified those already?
So we work closely with Overton as well as McMurray is not far from us, and Oliver is not far from us. So we definitely, as Ashley mentioned, diversity is important to us, and within our model, we want to make sure that we're encouraging that within the community. So those are some schools that alignment with our principles and our commitment. And we want to make sure when we expand that partnership, potential partnership, that those are aligned as well.
First of all, thank you for being here today. I have just a couple of questions. One, I'm glad that you all use Infinite Campus because that kind of ensures that you're getting reliable data. Secondly, when your training that you use, are you using outside providers for your trauma-informed or for your restorative practice?
Oh, we can see.
Yes.
Go ahead.
I'm actually the new Chief Culture Officer. Our previous Chief Culture Officer, Darren Dixon, is actually he is a licensed mental health provider, and he has designed and written all of the trainings, and before now would have been the one that would have been providing all of those. I also have a background. I was a school counselor before I came to Valor. So we have people that are licensed mental health professionals and or have worked with trauma-informed care who provide those trainings.
So these people, and I'm familiar with licensed mental health therapists, and I'm not sure which trauma-informed or restorative practice module that they've gone through. Do you know?
ACEs is our primary primary lens through which we provide that.
Do you all use any of the work when you mention protective factors? Are you all using any of the work from Search Institute?
I don't think so.
Okay.
I don't think so. And also to piggyback on what Ashley mentioned, we also use community, like our family partners have gone through mental health first aid and things like that around the community and a lot of lunch and learns. We're learning with each other, and we want to make sure that we're partnering with different organizations because we don't know what families need until we meet them and we get to know them. And we don't want to put them, as we mentioned, just like on a line in a checkbox. So we use a lot of community lunch and learns and different things like that too. No problem.
Quick question. How does the new landscape affect you guys? Because I was looking at the demographics and the communities. How is that affecting you guys?
As it relates to attendance?
The new landscape.
I would say we saw a big dip in attendance towards the end of the school year. And we are mindful of that as we start the school year, that some of our families are not as encouraged to come to school as they may have been before, but because we have generally as a model for our entire network, really good connections with our families, we find that they are telling us exactly why. If we call and say, why aren't you coming? They'll say it's because of this or that. And we can help there. But we did have a lot of kids who weren't coming at the end of the school year, and we had to make some accommodations for that.
And I think if you may not remember our impact data slide, but when we first started the program, we saw a 60% reduction, and then each year after that, and that was the pandemic, and there were different reasons why families were out. We saw a huge increase in that. But then the next year the trend was about 30%, but this year was 24%. So it was still an increase in impact, but it also was a little bit lower because of that. So.
I'm sorry.
No, don't.
Regarding the landscape, did you all have truants and petitions that you had to file simply because of reduced attendance?
I'm not aware of any that were because of reduced attendance due to some of the things we saw at the end of the year. Did we file truancy petitions? Yes. Was it because of stuff that was happening? I'm not for sure that that's the case. I would say that a lot of the kiddos whose families were calling and saying, I don't feel safe bringing my child to school, they had not really been attendance issues before, or they were already in the program, and so their attendance had improved already.
And I think also we make sure that we're looking at some of the data around family engagement. As she mentioned, if they're engaging with us, we want to make sure we have that data as well. When we're if we need to make a petition, and that is the rule, and that's what it is, we will also want to send that information that they are participating with our program.
Thank you.
Thank you so much for your time. Oh, yes, thank you.
Yeah, don't do that.
You know I like to move around a little. Thank you so much. Appreciate it.
Hello, good morning. Thank you. My name is Travis Claybrooks. I'm with Rafa Institute, and I'm here to present around our Accountability and Repair Conferencing, a violence interruption initiative, and I'll start with a video.
Breaking tonight, new video of a deadly crash on Nolensville Pike that killed a 71-year-old man. The driver that killed him was 13 years old.
This surveillance video shows the moment 71-year-old David Cheatham in the upper right-hand corner pulls out of the O'Reilly parking lot. When out of nowhere, this white car driven by a 13-year-old slams into him. After that, Janice got the call from police saying her husband was killed.
I just lost it. I couldn't dial anybody. I was pushing buttons and I was just screaming.
Why wasn't he in school? He is 13 years old. He should have been in school.
I'm 15 now. I'm a sophomore. I'm pretty normal, you know. I'll play my game every once in a while, watch TV. Like, you know, I stay in the house now. I think about the day all the time, the day when I crashed. It roams my thoughts.
Justice for me would be to see that kid realize that his actions affect everyone around him.
If something doesn't change in the system, and if this young man doesn't truly get rehabilitated, you're gonna have a repeat of he's done something else and he's back in the system.
We don't want to see two people lost. We want something else, an alternative.
At a Rafa Institute meeting, all eyes were on the topic of restorative justice.
Restorative justice is a way that we address trauma that results from crime in our neighborhood.
CEO Travis Claybrook says sometimes it involves the offender sitting down with the victim and mutually fixing the pain.
I have a background as a law enforcement officer. You know, I spent most of my time in inner city Nashville. It did not take long for me to see that our current criminal legal process is woefully inadequate. Once a case is referred to us, we engage with the people who've been harmed and the young person who caused the harm. Then we create a restoration plan that documents how this young person will make right the wrong that they caused. And once that young person executes that plan, the case is over. And this happens instead of prosecution. This Saturday would be the 1-year anniversary. And so the Cheatham family are processing that.
I remember him every day, never leave.
Nothing will ever replace him. And no justice could give him back to me.
This is also a year anniversary for the young man who caused this unbelievable harm. What do you think he's thinking?
At 13 years old, and to really come to the realization that you killed someone, I don't think I could have handled it And when I found out that he didn't have a seatbelt on and he only had a broken leg, it immediately came to my mind that there has to be a reason that he's still here.
We've been working with both of these families for nearly a year now. They're almost ready.
They got every right to just be so angry. I want them to express themselves. I want them to say how mad they are.
So, Ebony, when you and Amir do talk about this, like, how do those conversations go?
When it first happened, I had assured him that he was not a killer. It was an accident and someone's life wasn't spared. But yours was. I tell him, you owe it to the Cheathams. This is something he did. This is something that he's gonna have to deal with himself. I can't deal with everything for him.
A crash killed a 71-year-old man. A 13-year-old was behind the wheel after buying that car for less than $100.
The latest news only adding to the pain for David Cheatham's family. The teen telling investigators he bought the Dodge Dart involved in the fatal crash from Katrina Russell for $80.
That makes the hurt sting that much more, that this wonderful person died over $80. It makes no sense to us.
We are here because a man was killed, and a young man in our community is responsible for that. Our goal is to create the space where the participants heal themselves. We provide the environment for them to be able to do that. So Mrs. Cheatham has decided that she wants to start.
Amir, I'd like to know about what you like in school.
I like science because it's a lot of stuff to explore. We haven't even explored all of the world, and we use science to do that.
What kind of activities do you like?
I like football, I like wrestling, and like just playing the game, watching TV.
Well, I would like to know exactly what happened that you would purchase a car and drive it on the street.
I've seen people drive before, so it's like I thought I knew how to do it. So the morning when I wanted to go to school, I drove, but I never made it to school because the car almost hit me, so I swerved, and then I hit another car, and then he chased me. Light was red, and I went anyway. I was going like head first into a car, and I swerved like twice, and then that's when I hit Mr. Cheatham. I'm sorry.
He was the love of my life.
I'm so sorry.
At that moment, I did not like you. But then God worked with me to forgive you. I'm giving you permission to live the life of a good man. My dad was a good man, and your actions took that man. So you owe us by being a good man. That's how you're gonna make this right.
And that just goes to show how great of a man he was for y'all to feel like that, you know. Thank y'all for this opportunity, like, because y'all could have just been like, to heck with it, throw him away.
I really appreciate you going this route as opposed to prison. I have no words to really express how much that meant to us as a family.
This is really hard. I hate that this happened.
We want to see you become a good guy. And when you have kids one day, we want to see you playing with them, having as many pictures, you know, as you see here and more, just like our father did for us.
I want to say thank y'all for everything, and I also want to say I'm very, very sorry. I was in juvenile, and every day all I could say is, why him instead of me? Because I was doing wrong, and I knew that. I'll for sure like honor y'all wishes because I did takes one away. I will do everything in my power, and I will become a good man. Thank you.
No, thank you, man. Appreciate it. All right. Good.
Did good. Very good.
I feel a lot better. Something so catastrophic, the Cheatham family, they forgive me. They're amazing. It's like 1 in a million people that would do that.
That's Accountability and Repair Conferencing. It's a violence interruption program for young people who are charged with violent crimes, the harmed parties, as well as their families. It's a rigorous, intensive program that lasts 12 to 15 months, 5 days a week. An hour a day that can be graduated as they matriculate successfully through the program. We provide stability planning as well as resource acquisition for them, a rigorous anti-violence curriculum, trauma coaching, accountability coaching, as you saw with the conferencing there. How does this work? Through very high relationship, high accountability engagement, safe, stable, nurturing spaces where young people get the resources that they need, as well as the harmed parties and families. We operate under a MOU partnership with the Davidson County Juvenile Court, as well as the DA, the public defender, and the police chief. We've been under this MOU for 8 years now. We also partner with Tennessee Voices for Victims, the Tennessee Coalition to End Domestic and Sexual Violence, and the Metro Health Department to explore how do we reduce violence, especially among young people. We also have many community partners that we make referrals to. I'll talk a little bit more about Common Justice and Harvard University, but Equal Justice USA is also an organization, a national org that the Juvenile Court has been working with around this partnership. We are asking for $50,000 to continue to support this program, both from a programmatic and an operational standpoint. We want to scale this. We want everyone to have an option for this if they want it, all parties. Thinking about the evidence, we use a restorative justice framework that's rooted in adverse childhood experiences and understanding around that. That work has been cited by the Office of Juvenile Justice and Delinquency Prevention, as well as the CDC, as efficacious programs. We, Rafa Institute, have been cited by the Vera Institute of Justice, as well as the Annie E. Casey Foundation for our work in restorative justice over the last 8 years. We are partnering with Common Justice. They have been modeling this work for the last 17 years. They are actually training us and have been training us in this violence prevention work. In terms of our fiscal management, we have an array of tools that we use. We have policies and lots of financial oversight. We've been audited independently for the last 8 years, and we've had a clean audit every year for the last 8 years. In terms of our data collection, we collect both quantitative and qualitative data. We use intake forms, we use needs assessments, we use coaching notes, we use our client surveys and evaluations. We ask 3 main questions of our data. How much did we do? How well did we do it? And so what? Talk a little bit more about that. Salesforce, we've built a custom CRM on Salesforce for this that collects all of that demographic data. In terms of how much cases referred and the percentage of those cases that we actually accept from the court. How well did we do? That is measured by how much completion, what our completion rate is on those cases. And then so what? Are we actually reducing violence? That's our so what question. What do we hope to be true? We hope to see a 90%, greater than 90% acceptance rate, a greater than 80% completion rate, a less than 10% recidivism rate. Right now, we're at about 4%. And a person harm satisfaction greater than 90%. We're partnering with the Access to Justice Lab at Harvard University to do a randomized controlled trial over the next 12 months. So we're excited about the potential for that. And in terms of program sustainability, over the last 8 years, we have navigated about $4 million with this. Our current funding is from the Metro Health Department, Tennessee Office of Criminal Justice Programs, as well as the Tennessee Commission on Children and Youth, and also United Way. What we are hoping happens, wouldn't it be amazing if we woke up one day and the headline on the Tennessean was youth violence rate in Nashville, 0%. What if we woke up and could see no young people were no children were transferred into the adult legal system because of a violent crime. Where people have alternatives, people harmed by crime as well as people who have caused harm, they have an alternative that's durable, that's lasting, that's rigorous, that's meaningful, and transformative for them both. This is what accountability and repair conferencing offers us. We can no longer pretend that we don't know what to do. We simply need to invest in it. And I really appreciate the opportunity to present to you today, and I'm happy to answer any questions you might have.
Thank you for being here today to present. Fortunately, I am familiar with a lot of the resources that you use, but the one that, and I know that the restorative practice training and model is different for juvenile courts versus school-based or in community. So I know there is a huge difference. I would like to know what rites of passage curriculum are you using?
We are modeling from Common Justice and using their rites of passage. It's a 3-week engagement with the young person that really helps them get stable. We think about stability in 5 areas: housing, healthcare, education, economics, and social support, who you're hanging with. If we can help them create a plan based upon their needs assessment, that's how they move. So really, a large part of that curriculum they write themselves, but also we begin to prepare them around accountability and what that looks like, so that as they move towards having the conversation or meeting with their harmed party, they have some basis for that.
So the program is for 12 to 15 months.
Yes.
Is there follow-up after that, with it like another year, 2 years?
So the harmed parties, we provide those services to them for life. So as long as they feel like they need some service, we offer that to them. Once we enter a relationship with a young person, that's for life as well. So I met with a young person that we finished a case with in 2020. We're helping him and his wife and his 2 little children now help turn around on some of their employment. So there is that follow-up. We stay with them. We're your people. The strength of this is durable relationships that last a long time, which is why it's so expensive, because you're talking about payroll, right? You're paying people. Relationship is our technology. And so, yes, we stay with folks as long as they want to. That tends to be an informal engagement, but as formal as it needs to be. But it's not necessarily a part of the court process or the diversion process. Once their case is complete in court, they're done.
All right, so when we're looking at support 24 responsible parties or harm parties, are you talking about, how do you measure the harm party and the response? Is it the 2 people?
It's a case. So imagine like this, a homicide case,
Right.
a vehicular homicide. Young Amir is the responsible party. The harmed party would be the surviving family members. So the case, basically we're saying 24 cases.
24 cases.
That's essentially what we're saying.
Okay. And can you kind of give me an example of, like, how can you break down the outcome measures of this? Like, how are you measuring the Amir situation? Like, if somebody's just looking at it from purely, what is the outcome of this? If I'm pouring a resource into it, what's the outcome of that situation?
It's a great question. So we look at it from several perspectives. From the responsible youth perspective, of course, we look at recidivism. Do they get adjudicated on a new charge within 3 years of completing the program? If the answer to that is 1, 2, or however many times, that we say that they have recidivated. If not, then that recidivism rate for them is 0. For the harm party, we measure many things, like their sense of satisfaction with the process. And we do this with the responsible party as well. Their sense of satisfaction with the process, their sense of justice, their sense of healing. Did they get their needs met? Were they satisfied with the outcomes of the restoration plan? In this particular case, they had another conference where they went together and talked about, what does becoming a good man mean concretely? And they actually wrote a list of things that Amir completed over the next several months. So we measure their satisfaction not only with the process that they went through, but also with the outcome. Did they feel that the plan was meaningful to them and addressed their needs? So some of it's quantitative, some of it's quantitative. It's just pure numbers. 3 years. Did you recidivate? Yes or no? A lot of it's qualitative. What's the quality of your life and your experience with trauma and harm, and how are you feeling that and experiencing that today? So that's a self-report kind of thing.
I have one last question. When a young person is referred to your program, do you all look at the past behavior to see if there was additional juvenile incidents, or do you all look at that before deciding if the young person can join the program?
Not before deciding.
Okay.
It doesn't matter where you came from or what your story is. The reality is, and what we recognize is, if you have found yourself sitting in a courtroom, you probably have experienced a lot of trauma if you're 13 or 14 or 15 years old. Absolutely. So we know that that's a reality that the young people face. So that's an assumed thing. There are some indicators, though, that let us know that things might be more challenging. For example, if a young person is currently in DCS or has been in DCS custody, we know. We've done enough of the cases to know, okay, that's going to be a difficult one, and we're going to have to dedicate resource to that. Are they in school? Have they attended school? What's their literacy and numeracy like? A lot of times we see the kids, they come, they aren't doing well in school, they drop out, they get in trouble, they start hanging around the wrong people, then they're in court. By the way, Amir graduated from high school this past May, and he is wanting to go and start his HVAC business. He's doing well. That's something that we look at. One of the things that Harvard is going to help us do is to think, because we're 8 years now, what's the long-term efficacy of this? What are kids and people looking like as they move into adulthood? You're 13 years old, you kill somebody. Life is going to be different when you turn 18, 21, 25. You're going to be thinking about all of that differently, right? Did this program have an impact in that long-term outcome that you're experiencing? Are you working? Did you graduate from college? Did you get a trade? Those kinds of things.
And just following up on Amir, for somebody like him or any others, is there mental health counseling involved?
Yes, we make referrals. That's some of the community-based work, Black Mental Health Collective. Those are partnerships that we have. Mm-hmm. When they want it. By the way, this is completely voluntary. When a case is referred to us, we then talk with the harmed party and the responsible party or the accused party at that point. If they want to participate, then they can. If they don't want to participate, we send it back to the court for them to go through that process. So it's completely voluntary. Thank you. Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.